Good morning. This hearing will come to order. Today's hearing is toxic trailers. Has the Center for Disease Control failed to protect public health? The Agency for Toxic Substances and Disease Registry, ATSDR, is a constituent agency of the Centers for Disease Control and Prevention, the CDC. Its mission is to serve the public by using the best science, taking responsive public health actions, and providing trusted health information to prevent harmful exposures and disease related to toxic substances. The staff of the subcommittee has engaged in more than 100 hours of interviews and read thousands of pages of documents in preparing this morning's hearing on this matter. The ATSDR failed in its mission in producing a health consultation for the Federal Emergency Management Agency, FEMA, on the possible health consequences of formaldehyde exposure in trailers provided by FEMA to survivors of Hurricanes Katrina and Rita. ATSDR failed in what it produced in the consultation, but ATSDR's greatest failings were in what it left undone. ATSDR's failings were not just in scholarship, in academic disputation, in obscure learned journals. Tens of thousands of Katrina and Rita survivors, economically and politically powerless, vulnerable people, were living in the FEMA trailers. ATSDR released the consultation to FEMA on February 1 last year. The consultation concluded that formaldehyde levels in the trailers would be, quote, below levels of concern, quote, so long as the doors and windows were left open to air out the trailers. The level of concern was established at 0.3 parts per million. We will hear this morning that is a level well above the level exposure that would likely cause adverse health consequences in sensitive people. And the report was entirely silent on the risk associated with continuous long-term exposure to formaldehyde. In short, ATSDR issued a scientifically flawed report and failed to correct the record when they knew that the report was significantly flawed. And the result of that failure was that thousands of Americans were exposed to unsafe levels of formaldehyde fumes for a full year after the ATSDR and FEMA knew or should have known the real health risk of the formaldehyde exposure. It was not until February 13 of this year that the head of CDC, Julie Gerberding, announced that CDC was encouraging people to be moved out of the trailers as rapidly as possible. This is not an instance of lower-level employees acting without the knowledge of the leadership of ATSDR or CDC. The facts are these. The analysts who did this report were approved for this task by the Deputy Director of the agency, Dr. Tom Sinks, in July of 2006. The analysts produced a report that was then sent directly to the emergency response officials in the Director's office. On January 8, 2007, the draft report was briefed to the Director, the Deputy Director, and the senior staff of the Director. And the briefing did not include the division directors that possessed the technical expertise to evaluate toxicological or epidemiological studies. The SDR was given a copy of the draft report and told committee staff that he cannot remember whether he ever read it in January of 2007. The Deputy Director was given a copy of the draft report and remembers reviewing it at least one time. The analysts believe that review processes went through 4 rounds, providing comments back to the analysts on what they needed to do to improve the report. There was no process in place to guarantee that anyone else between the 2 analysts and the Director and Deputy Director had a chance to review the report. There was no control sheet to indicate to the Director who else had reviewed it. In most agencies, this is a standard form to guarantee that a document has received the proper clearances. This whole process for moving Katrina-related consultations, was established at the personal direction of Dr. Howard Frumkin, the Director of ATSDR. In sum, there was a failure of leadership to establish effective systems to guarantee that important public health documents were reviewed properly and based on the best science. There was also a stunning lack of concern for how important this consultation was to thousands of American families. It appears that this consultation was received only a cursory view by the director's office, by the director himself, and the deputy director claims only the vaguest memories of any concerns regarding the report. Another director, another official at ATSDR, had a very different reaction to the formaldehyde consultation when he saw it. After the report was reviewed and approved by the director, ATSDR sent the report to FEMA. When it was then distributed within ATSDR and landed on the desk of Dr. Chris DeRosa, the head of the Department of Toxicology and Environmental Medicine, he was appalled. He immediately emailed Dr. Frumkin to urge that they send a letter, ATSDR send a letter to FEMA, effectively withdrawing the report. When he didn't receive a response, Dr. DeRosa sent his letter again, sent a letter draft to Dr. Frumkin, and said that he would assume that unless Dr. Frumkin got back to him by the end of the next day, that Dr. Frumkin intended to do nothing, and Dr. DeRosa would send the letter himself. Dr. Frumkin then agreed to have ATSDR send the letter over the signature of an official from the responsible office, in this case an official in the director's office. ATSDR finally sent that letter on March 17, 2007. The letter read, in relevant part, the health consultation has been completed without a policy review by our senior technical staff. I am concerned that this health consultation is incomplete and perhaps misleading. This letter, like the prior consultation, was sent to the Office of Chief Counsel at FEMA, to Mr. Rick Preston, an attorney there. Mr. Preston told our staff that he simply put the letter in his file and did not mention it to anyone else at FEMA. But with that letter of repudiation, the leadership of ATSDR washed their hands of the report until awkward questions came up at a hearing by Chairman Waxman last July. In the wake of that hearing, Dr. Frumkin ordered a revised consultation posted in October 2007 and shifted the blame for the consultation, the failings of the consultation, arguing that Dr. DeRosa, who was the one who asked the questions, the awkward questions about the report, should be removed from his position because of the poor quality of the formaldehyde health consultation. I want to make it very clear to the management of CDC and ATSDR that this committee considers Dr. DeRosa to be a whistleblower. Much of our information about this came from Dr. DeRosa originally. I have joined Chairman Gordon and Chairman Lamson in signing a letter to Dr. Gerberding expressing that position very forcefully. I think I have made it very clear that there are officials at ATSDR who should be on a professional improvement plan, a PIP, in the jargon of federal employees. It isn't Dr. DeRosa. And I want to emphasize that nothing should happen to Dr. DeRosa except that he be restored to his previous position. Think back to when you were a child and you were sick. The safest place was to be at home in bed. Here we have government providing families with homes that were making children sick. Where do those children go to be safe? Where do families turn for help? The ATSDR is mandated to intervene to protect the public from adverse health consequences of toxic chemicals. But in this case, we find the leadership at the very top level of the agency with little interest in the actual work that would be required to do that. Take a look at the testimony. The testimony from ATSDR is inspiring, it's aspirational. They say all the right words of concern and commitment, but their actions and their inactions speak much louder than their words. The nation needs much better leadership from ATSDR and the CDC. Now, I will recognize Mr. Sensenbrenner of Wisconsin.
Thank you, Mr. Chairman. Today's hearing touches on some of the core issues lawmakers face in implementing policy based on science. As the former chairman of this full committee and the ranking member of the subcommittee, as well as being the ranking member of the Select Committee on Global Warming, I probably have had more experience with this intersection than most of my colleagues. How do you rely on good science to make informed decisions in the public interest? First and foremost, good decisions require good science and good scientific recommendations. The Agency for Toxic Substances and Disease Registry, which I'll refer to as the ATSDR, as the chairman has failed us on this count. ATSDR's mission is, quote, to serve the public by using the best science, taking responsive public health actions, and providing trusted health information to prevent harmful exposures and disease related to toxic substances, unquote. This mission is intended to serve not only lawmakers and other federal agencies, but also individuals like today's witnesses. Lindsay Huckabee. Ms. Huckabee's family experienced various health problems since moving into trailers provided by the Federal Emergency Management Agency. To date, too little has been communicated about what effect the formaldehyde levels in her FEMA-provided trailer have had on her family's health. After an extensive subcommittee investigation, it appears that one of the principal failings within ATSDR is its review process. I hope to hear testimony from agency officials about that review process and how it can be strengthened in the future to prevent situations like this from occurring. Regardless of the merits of an individual scientist, good scientist requires review and contribution from various perspectives. On at least 2 recent instances, ATSDR has proven itself incapable of sufficient review. ATSDR recently released a report entitled Public Health Implications of Hazardous Subjects in the 26 U.S. Great Lakes Areas of Concern. ATSDR began work on that report in 2002 and largely completed it by 2004. The study was reviewed by external peer reviewers and cleared for release by ATSDR in July 2007. Days before its slated release, ATSDR's leadership withheld the report's release because, according to the agency, significant scientific concerns had come to their attention. I am convinced that those concerns are legitimate. I am therefore confused as to how the report cleared ATSDR's review process. Watchdog agencies and congressional committees are justifiably concerned when a report on public health is pulled with minimal explanation days before it's released. If this report was so fatally flawed, why were problems not uncovered during ATSDR's 2 years of review before the report was cleared for release? ATSDR's initial health consultation on formaldehyde levels in FEMA trailers similarly failed the public. That consultation, titled Formaldehyde Sampling at FEMA Temporary Housing Units, dated February 1, 2007, concluded that the average concentration of formaldehyde per day in ventilated trailers after the 4th day of sampling and for the remainder of the study was below the level of concern for sensitive individuals of 0.3 parts per million. That conclusion led FEMA to believe that concentrations of formaldehyde in FEMA-provided housing units did not present a public health hazard. That was not the message the report's authors intended to convey. A competent internal review process could have determined that the consultation was potentially misleading before it was ever transmitted to FEMA. First, competent review could have determined that there were potential problems with the report's stated level of concern. The consultation does not discuss why it chose this level, nor does it discuss that problems could occur at much lower levels. The stated level was 3 times higher than the level used by several other government agencies, and according to many experts, above the level where many individuals will experience negative health effects. While the consultation's authors had a strong argument for choosing this level, the level should have been subject to at least some degree of internal review. The health consultation also focused exclusively on the short-term effects and failed to mention the potential long-term effects of exposure to formaldehyde and the possible risk of cancer. Dr. Christopher DeRosa, then the ATSDR's director of the Division of Toxicology and Environmental Medicine, first read the release nearly a month after it was transmitted to FEMA. He pointed out some of the consultation's flaws and argued that as written, it was perhaps misleading. On March 17, 2007, ATSDR wrote to Rick Preston in FEMA's Office of General Counsel, who had originally requested the consultation and raised these concerns. Mr. Preston, however, did not share these concerns with other officials at FEMA. For its part, ATSDR took no action to immediately revise its report, nor did it raise any protests as FEMA continued to rely on the health consultation as evidence of the trailer's acceptability. A month and a half after the report was transmitted to FEMA, the report was still flawed and the public was still uninformed. As today's hearing will make clear, far too little is known about the effects of formaldehyde and about what levels should be considered problematic. Clearly, risk managers have to accept exposure to some level of formaldehyde. Suggestions that there is, quote, no safe level of formaldehyde are simply not helpful because formaldehyde is ubiquitous. Sitting in this hearing room today, we're breathing in formaldehyde. It has long been known that these levels are higher in trailers and mobile homes, both because of the materials used and the relatively poor air exchange. But exactly what level is unacceptable is not clear. A report dated February 29, 2008 from the Centers for Disease Control titled Interim Findings on Formaldehyde Levels in FEMA-Supplied Travel Trailers, Park Models, and Mobile Homes provided information about formaldehyde levels in FEMA-supplied occupied travel trailers, park models, and mobile homes that were still being used as of January of this year. This report found that the average formaldehyde concentration of these units was 77 parts per billion, well above what it termed the typical U.S. background levels of 10 to 30 parts per billion. The range of concentration in tested trailers was, however, extremely broad. The lowest tested trailer registered only 3 parts per billion, well below the U.S. average, while the highest concentration measured 590 parts per billion. The interim report recommended fast action, finding that its conditions supported the need to move quickly before the weather in the region warms up to relocate residents of the U.S. Gulf Coast region displaced by Hurricanes Katrina and Rita who still live in travel trailers, park models, and mobile homes. This recommendation is broad, sweeping, and authoritative, but it raises as many questions as it provides answers. Does the CDC recommend relocating everyone in FEMA-provided trailers, even in those trailers with formaldehyde concentrations below the typical background norms in U.S. homes? If not, what level is the appropriate level of concern? Should Americans living in trailers and mobile homes not provided by FEMA be concerned about formaldehyde levels? Do we need wide-scale testing for formaldehyde concentrations? The public will not be served by drastic action based upon limited science. Relocating individuals who are experiencing health effects is an urgent priority, but causing a panic among individuals who are perfectly safe will only result in unnecessary expense and neglect of those who are actually in need. We need a clearer understanding of formaldehyde and its effects on human health before we act more broadly. As the ranking member of the Global Warming Committee, I know too well how science, intensified under constant media exposure, can lead to paranoia that seems to require immediate, wide-scale, and admittedly well-intentioned action. As policymakers, we depend on agencies to produce high-quality, thoroughly reviewed science and to provide prudent, objective advice. We haven't gotten it from ATSDR, and as a result, we're really operating in the blind in terms of what our response should be to this problem. And I thank the chair for indulging me to speak for more than 5 minutes.
Thank you, Mr. Sensenbrenner, and I appreciate your going more over your time than I went over my time, making me look better by comparison. I now ask unanimous consent that all the additional opening statements or any additional opening statements be included in the record. Without objection, it is so ordered. And I also ask unanimous consent to enter into the record documents that have been collected by the subcommittee during the course of its work on this matter, and those documents have already been provided to the minority. Without objection, so ordered. I now would like to introduce our witnesses, our first panel today. Our first witness is Dr. Heidi Sinclair. Dr. Sinclair is Assistant Professor of Pediatrics at Louisiana State University and is the Medical Director of the Baton Rouge Children's Health Program. Ms. Lindsay Huckabee lived with her husband and 5 children in a FEMA-provided mobile home in Kiln, Mississippi, from October 2005 until just last month.
Well, gentlemen, yield.
Yes.
We know all about the Kiln, Mississippi, because of your favorite son. You telling me he ought to go back to work. That's Brett Favre.
The ranking member agreed earlier that all sports analogies would be college basketball, but I think the early exit of the University of Wisconsin has changed his view. Our last witness is Miss Becky Gillette, the Formaldehyde campaign manager for the Sierra Club Gulf Coast Environmental Restoration Task Force. Welcome to all of our witnesses. You will have 5 minutes for your spoken testimony. Your written testimony will be included in the record for the hearing. When you all complete your testimony, we will begin with questions, and each member will have 5 minutes to question the panel. It is the practice of this subcommittee to take testimony under oath. Do any of you have any objection to being sworn in? If not, you may also be represented by counsel. Is anyone here represented by counsel? Now, would you please stand and raise your right hand? Do you swear to tell the truth and nothing but the truth? All the witnesses affirmed that they would tell the truth. Dr. Sinclair, please begin.
Good morning. Thank you, Chairman Miller and Congressman Sensenbrenner, for inviting me to testify today. My name is Dr. Heidi Sinclair with the Louisiana State University Health Science Center. The views expressed herein do not reflect the views and opinions of LSU HSC. I'm here by Hurricane Katrina and relocated to Baton Rouge in June of 2006 to accept the position of Medical Director of the Baton Rouge Children's Health Project, established post-Katrina by the Children's Health Fund in collaboration with LSU Pediatrics in Baton Rouge. Our project's mobile medical units have provided comprehensive medical and mental health care to over 400 children and families displaced to the Baton Rouge area. As FEMA trailer group sites were being established, a number of concerns were expressed regarding the safety and suitability of both the travel trailers and the group sites themselves. We were concerned then, as we are now, that people living in these trailers are continually being exposed to formaldehyde, which is most readily absorbed through the respiratory tract by breathing. Symptoms associated with formaldehyde exposure include sinus irritation, respiratory problems, skin rashes, eye irritation, nausea and stomach aches, as well as neurological problems such as headaches, fatigue, depression, insomnia, and difficulty concentrating. Since we began seeing patients at the FEMA trailer villages, presenting problems have included many symptoms consistent with formaldehyde exposure. While ATSDR lists 0.008 parts per million or 8 parts per billion as minimal risk level for long-term formaldehyde exposure, it is important to emphasize that much remains unclear about formaldehyde. Most human studies have been limited to adult occupational exposure. Children, however, are more likely to be affected by even low-level exposure to formaldehyde in their living environment because they generally spend more time at home, have a higher respiratory rate, have a greater surface-to-mass ratio, are closer to the ground, and formaldehyde concentrations are higher closer to the ground, and have immature metabolic systems that may not enable them to clear absorbed formaldehyde as quickly as adults. So concerns about possible long-term consequences of formaldehyde exposure, which include changes to the immune system that can increase allergic responsiveness in general, possible reproductive or developmental toxicity, an increased risk of nasal and nasopharyngeal carcinomas, and possibly lung cancer, throat cancer, or blood disorders. Following reports in 2006 of elevated formaldehyde in the Mississippi Gulf Coast area travel trailers, I discussed concerns regarding formaldehyde in travel trailers in our area with colleagues at the Office of Public Health, the Children's Health Fund, and elsewhere. The health consultation of formaldehyde sampling at FEMA temporary housing units released by ATSDR in February of 2007 7. Added confusion regarding what might be considered safe levels of formaldehyde. In this report, 0.3 parts per million, or 300 parts per billion, was chosen as the level of concern. This level, however, is nearly 40 times higher than what is established by the ATSDR as minimal risk level for long-term exposure. Misinterpretations of this study and other misconceptions may have served to minimize understanding of the possible exposure risk to those living in travel trailers in our area. In July 2007, FEMA announced that they would work with CDC to test occupied travel trailers. I contacted the CDC and learned that the testing would be random. Residents would not be able to request to have their trailer tested. It was unclear if individual results were going to be given to residents, and the actual study start date was unknown. The Sierra Club provided our project with a few test kits. All of the tests were elevated, with 7 of the 8 trailers testing between 100 and 300 parts per billion, 10 to 25 times above ATSDR's minimal risk level for long-term exposure, and at least 5 times above levels often present in conventional homes. A summary of this testing sample was shared with persons with the Office of Public Health, the Children's Health Fund, and others. I was contacted in the summer and fall of 2007 by CDC representatives and participated in a phone conference with CDC representatives regarding their upcoming study on occupied travel trailers. ATSDR's October 2007 update and revision seems to be an effort to clarify that their February FEMA consultation was not meant to imply that formaldehyde levels in the travel trailers were safe for long-term occupancy. This update also mentions concerns of CDC, NCEH, ATSDR, and EPA representatives as early as July 2006 that the study requested by FEMA, quote, could not be generalized and applied to occupied trailers in the Gulf region, unquote. In summary, I would like to share my conclusions and recommendations. First, I am glad that FEMA acknowledged that travel trailers are designed for short-term recreational use and are not intended for housing. I recommend that FEMA more actively involve local government, nonprofits, and family and child advocates in planning safe and appropriate housing options for displaced families. Second, I am surprised that the CDC did wait so long to initiate formaldehyde testing of occupied travel trailers, given the stated concerns of some of their own representatives as early as July 2006, and given reports by ATSDR in February of 2007 that cited formaldehyde levels so greatly above their own defined minimal risk level for long-term exposure. Third, formaldehyde exposure is just one of many problems being faced by families displaced by Hurricanes Katrina and Rita. It is unacceptable that so many families must endure uncertainty and concerns regarding their exposure to elevated levels of formaldehyde, in addition to daily anxieties and stresses of displacement. Fourth, as FEMA works with local agencies to find more appropriate and safe housing solutions for families, we recommend that coordinated efforts be made to prevent any further disruption and endangerment. Finally, I recommend that the CDC consider expanding their proposed child health study to a wider sample of children displaced, affected by Hurricane Katrina, and look forward to contributing to such a study in any way I might be able. Thank you.
Thank you. Neither the chair nor the ranking member set a good example in staying within the 5 minutes, and we will be somewhat indulgent, but kind of bear in mind that there is at least a 5-minute suggestion of the limit of the oral testimony. Mrs. Huckabee.
I'd first like to thank the committee for bringing this up in Congress and holding somebody accountable for what's been going on. My name is Lindsay Huckabee. I'm not an expert on formaldehyde. I'm not a scientist. I'm a woman, a wife, and a mother who spent countless hours dealing firsthand with the effects of formaldehyde. On August 29th of 2005, our apartment was destroyed along with all its belongings. We contacted FEMA and were told that we qualified for their temporary housing program. We received a trailer in December of 2005. It was a single-wide mobile home, not a travel trailer like many people believe. Whenever we first entered it, we noticed that there was a real strong offensive smell. We had sinus issues going on. My 6-year-old immediately started having nosebleeds along with my 4-year-old. In the 29 months since we received our first FEMA trailer, our family has suffered many health issues. 4 of my 5 children have been treated for asthma. 4 of them are currently on prescriptions for breathing treatments, none of which were asthmatic before we moved into the trailer. My husband and I have allergy symptoms, sinus symptoms, and we've been tested for allergies and nothing shows up on a test. My husband had a tumor in his soft palate that was removed. It was considered non-cancerous but still malignant because of its rate of growth. Our ear, nose, throat doctor feels that formaldehyde could have been a contributing factor to this. While it cannot be proven, he said that he will make a note of it for further study. My daughter Layla was 4 when we moved into the trailer. She's now 6. She developed moderate asthma. She's had sinus infections severe enough to require 2 surgeries. Whenever I asked the ENT if these surgeries were really necessary because they were very invasive, he asked me if I could be out of that trailer in 30 days or less. I told him that no, I had nowhere to go. He said then she must be put through this because he fears that her nasal passages would not be wide enough to exchange air. We had a formaldehyde test done on our trailer in April of 2007. Our first trailer was a Fleetwood home built in November of 2005. The test came back at 0.18 parts per million. 0.1 believed to be harmful to humans. There's no way to know how high it was in the 16 months we lived there before having it tested. Since FEMA and the CDC suggest that opening windows will outgas the fumes and lower the level, I have to believe it was much higher since we did this repeatedly. We reported our findings to FEMA. We were told that we would be provided with a replacement unit that would be formaldehyde free. The second trailer was a 2005 model built by Destiny Homes. We had a formaldehyde test done on it before we moved into it, found that its levels were 0.018 parts per million. It was lower than the ones that we had received, but in researching, I found that 0.008 is what is considered safe for long-term use. This was still above that. Whenever I informed FEMA of our new findings, they said it's lower than the one you had before, so we're good, right? I testified in the hearing in Washington, D.C. in July of 2007 regarding the FEMA and the formaldehyde issue. Whenever I got back, we received a pamphlet saying that they were working with the CDC to find safe levels. When I called FEMA to the help number they gave us, she told me I needed to call the CDC to find out what was the safe level of formaldehyde. We called the CDC number that was provided by FEMA. First, we were told to call FEMA back. The CDC wasn't handling that. After insisting that I'd already called FEMA and were told to call the CDC number, I was transferred to 6 different people, none of which were willing to give me a name or an employee ID number. Each one told us they knew nothing about formaldehyde, that they didn't know anything about any levels, and one of them even told us she didn't know anything about working with FEMA on this. So whenever we got off the phone, we were just as confused as we were in the beginning. I was able to meet with some of the CDC director or some of the CDC employees at a town meeting held. I was told by one of them they knew nothing about the formaldehyde until after the July 2007 hearing. I find this really hard to believe considering my own pediatrician had spoken with the CDC about doing a child health study. We went back and forth with the CDC trying to get a safe number to find out, we were running air purifiers trying to find out if our trailer was indeed safe. We saw a decrease of symptoms once we had the air purifiers running. We were told that there is no safe level of formaldehyde for living in 24 hours a day. I feel like since the CDC and FEMA and the ATSDR all knew a year in advance from today about the formaldehyde in the trailers, I feel like essentially we were lab rats. We were put in this situation, we were exposed to this, and seeing as this large group of scientists knew about it, it seems like they should have at least been doing studies to find out what the effects were. This is not a new chemical. It's been around, used in everything for decades, if not longer. I think that it's a shame that this high-tech agency has no more information on this than they do have.
Thank you, Mrs. Huckabee. Ms. Gillette.
My name's Becky Gillette, and I'm Formaldehyde Campaign Director for Sierra Club. After Katrina became common knowledge that the FEMA trailers had serious air quality problems, people complained about burning eyes, respiratory problems, rashes, headaches, and even bloody noses. Sierra Club began formaldehyde testing in April of 2004 and continued through 2007. What we found was that 61 out of our 69 tests, 88%, were over the 0.1 ppm limit that EPA has set. And when you use the much lower levels recommended by the ATSDR recommendations, not a single trailer was safe. We tested 17 different brands of trailers, and all had at least one high test. And there were 3 deaths of people in the trailers that we tested that we believe could have been caused by the formaldehyde. Finally, in October of 2006, over a year after Katrina, many people have been in the trailers for over a year, EPA tested the trailers. But there was delay after delay in releasing the results of those. FEMA had asked ATSDR to evaluate those test results. I also contacted ATSDR several times, and no one ever got back to me. When it was finally released, the ATSDR health consultation was a huge disappointment. The report said that formaldehyde averaged 1.2 parts per million at the beginning of the test and dropped to 0.3 ppm after 4 days of constant ventilation. This was shocking because 1.2 parts per million is extremely high, and I found it incredible that ATSDR could say 0.3 parts per million was below the level of health concern. At that level, most people that walk into a trailer will experience immediate distress. And ATSDR's own standards were many magnitudes lower. ATSDR gave completely erroneous advice covering up this problem when the health of tens of thousands of families was at stake. Finally, in October 2007, over 2 years after Katrina, a year after the EPA testing, ATSDR revised its health consultation to more accurately report the problem. But that was 2 years that women were living in these trailers, getting pregnant, having miscarriages, having stillbirths, and losing babies to SIDS. Adults and children were getting cancer. People with asthma were literally finding it difficult to breathe, and mothers are getting up in the middle of the night to give breathing treatments to their children. I recall calling Earl Shorty to give him the results of their FEMA trailer testing. His wife, Desiree Collins, was coughing so bad in the background that it was painful to hear her. A few days later, she passed away. One woman I tested, Teresa Coggins, a diabetic, went into a coma for 8 days, running up a $100,000 hospital bill. Another woman, Christine Lawrence, told me that her head felt like a balloon that was about to burst. But did FEMA and ATSDR care? No. There was a callous disregard for the health of the trailer residents, and there was an appalling lack of urgency. But this negligence is only the tip of the iceberg. Contaminated communities often feel let down by ATSDR. Attorney Monique Harden, co-author of a report that details the injustices of ATSDR in Mossville, Louisiana, says, quote, any help that you can provide in getting the Science and Technology Committee to connect the dots between ATSDR's role in the toxic FEMA trailers with its, quote, public health, unquote, work in communities plagued by pollution would be greatly appreciated. The problem that we have is that ATSDR's conduct in the FEMA trailer crisis is not an aberration, but is consistent with the way it has always worked. Sal Meyer, who retired from the CDC as director of the Division of Prevention in the Dallas Regional Office, wrote, we strongly believe there's a national pattern in the manner in which ATSDR conducts their consultations and assessments, and that this pattern could result in great risks to the public health of many communities. It is our perception that ATSDR embodies a philosophy and consequently a methodology and guidance that is designed towards the non-identification or trivialization of public health problems, end quote. Our tax dollars are being used to lie to us about the impact of toxic pollution. The harmful and inaccurate advice regarding formaldehyde in FEMA trailers is just the latest example. Congress could help by calling for an independent National Academies of Science investigation into the process by which health consultations are developed and communicated. Katrina was, quote, the perfect storm to expose formaldehyde poisoning that's been allowed in our buildings now for decades. FEMA just purchased what was available to sale for the general public. There are many other people other than disaster victims who are at risk here. The CDC needs to take immediate steps to do a nationwide health survey and consultation regarding formaldehyde in building materials. If there's one benefit that can come out of all the misery and death that's resulted from formaldehyde in FEMA trailers, let it be that the citizens of the U.S. are finally afforded the same protections that are provided under law in Europe, Japan, and even China. Thank you.
Thank you. We will now have our first round of questioning, and my hope is that this panel will be limited to one round of questioning because we have more to go. I can tell that none of you appear disappointed that there will only be one round of questioning from each of us. Ms. Gillette, you've just testified about the Sierra Club's initial testing as early as April of 2006. You released those publicly. They were in the press. Did you get contacted by anyone at ATSCR, CDC, FEMA about the results of your test, about your test?
No, ATSCR, I just got the runaround from them. They kept saying on email they would get back with me, and they never did. Finally, over last July, someone with NIOSH wrote and asked for the results of our testing, but we were never, given the opportunity to tell them about the scope of the problem. And the thing that really bothered me is I didn't feel like there was any bureaucrat that was actually coming and spending even 15 minutes in these trailers, let alone stay overnight in them and find out what it's really like to have to live with those kind of high formaldehyde levels.
Okay. Ms. Huckabee, I think that Ms. Gillette just said that she thought that there was a trivialization of health consequences. The ATSCR health consultation in February of 2007 described the results below the 0.3 level, 0.3 level parts per million, as being a nuisance effect. Would you describe the effect on your family?
If you consider nosebleeds, sinus infections, asthma attacks, repeat hospitalizations for pneumonia, asthmatic bronchitis, tumors. If you consider all of these minor nuisances, then I guess you could agree with it. I mean, after all, it could be worse, I suppose.
I'm advised by our able staff that that was not actually in the written report, but that is based upon the nuisance effect is based upon interviews with staff. Dr. Sinclair, I know if you have tens of thousands of Americans over the course of couple of years, they're going to have bad things happen to them. You heard Ms. Gillette describe deaths in the trailers. Do you concur that the formaldehyde exposure may very well have been a contributing factor in some of those deaths?
I would say it very well may have been a contributing factor. You cannot prove cause and effects, but many of the symptoms that our families, children exhibited, while common in a general pediatric population, are also associated with formaldehyde exposure.
You described in your testimony the effects that may come, the health effects that may come from formaldehyde exposure. What did you observe personally in your treatment in seeing families that lived in those trailers?
The travel trailers in our area may not have had as high levels of formaldehyde as those in the Mississippi Gulf Coast because most of them were put together before Katrina and not put together as quickly after Katrina as those in the Mississippi Gulf Coast. The symptoms that many of my patients were exhibiting were not as dramatic as many of those reported by pediatricians and families in the Mississippi Gulf Coast area. However, they were persistent and difficult to treat. What I'm more concerned about are the possible long-term health effects of these families' exposure to formaldehyde over the past 2.5 years.
And what do you think should be the what should we do to track the health of those folks who've been in the trailers for health consequences? Should there be a continuing effort to pay attention to their what happens to them medically?
I believe so. First of all, families should never have been put in these travel trailers to begin with. They're not meant for living. They're not up to electrical standards. They have stoves that would explode. They're not up to storm standards. They're very small, 200 square feet. That being said, now that people have lived in these travel trailers for a year, 2 years, 2.5 years, I think it would be very beneficial to create a data bank to track families and children, and to follow their long-term health. And so if there's certain concerning symptoms, that future healthcare providers could be alerted to the fact that they had lived in the travel trailers and maybe have a little bit higher level of concern that some of the symptoms might not just be your general cold, asthma, allergies, but maybe a symptom of something more concerning.
Ms. Gillette, what effort do you think there should be to follow the longer-term health of the
Well,
people in the
I
trailers?
actually think it's not enough to follow their health, that you need to provide free health care to people that have been poisoned by their own government. And the problem is that many of these people are still struggling to get their lives back together. They lost everything in the storm. There's no affordable housing that you can get into. Rental rates have doubled. The government needs to get some sort of formaldehyde SWAT team together that really bones up on how do you treat people that are exhibiting the symptoms of formaldehyde poisoning, because a lot of the healthcare providers don't know, and they're actually in some cases giving treatment that we think may be doing more harm than good. So we really need just a concerted effort on training people that are specialists in treating families that have been exposed to formaldehyde this long. After people have been exposed to high levels of it, they become more sensitive. Many of them may get multiple chemical sensitivity. So there really needs to be some free clinics provided for these people. And again, as far as tracking, I'll just say one thing. Some of these people have moved all over the U.S., and it's going to be difficult to track them, but definitely it needs to be done, and not just for children, but also for adults.
Thank you. As an example to the other members of the committee, I will limit my 5 minutes of questioning to 6.5 minutes. Mr. Sensenbrenner, for 5 minutes more or less.
Be less. There are two aspects to this issue. One is the aspect of the fact that there have been people who have been exposed to unacceptably high levels of formaldehyde because the ATSDR did not do its job properly. The other issue is to make sure that a catastrophe like this never happens again. And I think that this committee could probably be the most constructive in getting on the back of ATSDR to make sure that their medical and scientific review process passes the smell test. And this obviously did not pass that test, because it certainly was not acceptable science. And what is more problematical, in my opinion, is that the deficiencies in the ATSDR report should have been caught earlier on and were not. Now, this is not the only case where the ATSDR has not only dropped the ball but fumbled it in the end zone. And in my opening remarks, I did refer to the issue of the public health implications of hazardous substances in 26 U.S. areas of concern in the Great Lakes. Let me say that there was a premature release of that report. The public health officials, both in Wisconsin and Minnesota, reviewed the prematurely released report and have sent letters to Dr. Howard Frumpkin, who is the director of the ATSDR, stating that his report failed. And this is a little bit closer to home for me than the Gulf Coast is, but it shows that the problems of inadequate and erroneous scientific review in the ATSDR are not limited to the issue of formaldehyde in the trailers that FEMA provided to people who were displaced by the two storms, but in analyzing toxic substances in what I think is probably the greatest natural resource in the United States, and that's the Great Lakes, which are the largest body of fresh water in the world. I ask unanimous consent to include the letter from the state of Wisconsin Division of Public Health, signed by the Chief Medical Officer, Henry Anderson, MD, as well as a letter that was sent to Dr. Frumkin by the Minnesota Department of Public Health, and specifically by John Link Stein, who is the director of the Environmental Health Division in Minnesota. And I want to have the record be as complete in its indictment of how bad the ATSDR has been and how much they have opened up the population of this country to disease and serious medical conditions because they haven't done their job properly. And I would hope that this hearing at minimum would be a lesson to them that this should never happen again. And if it does happen again, if folks here from the ATSDR and the CDC think that today's price to pay is pretty high, to quote Ronald Reagan, you ain't seen nothing yet. I yield back the balance of my time to the chairman.
Thank you. Without objection, the documents that Mr. Sensenbrenner has moved be entered into the record are so omitted. The chair recognizes Ms. Hooley for 5 minutes of questioning.
Thank you, Mr. Chair. I will be rather brief. I have a couple questions for Dr. Sinclair. First of all, I understand that your own mobile unit had high levels of formaldehyde in it. Did you experience any symptoms firsthand?
First of all, as a displaced person, I was actually living in a FEMA trailer in New Orleans for half the week while I was commuting back and forth the first year before I relocated to Baton Rouge. And I had headaches the whole time I was there. I had difficulty sleeping. This was before I knew anything about formaldehyde. I always kept my windows open and the doors open, and I assumed that my headaches were because I wasn't sleeping well. As far as our own medical mobile unit, when we come on in the mornings, especially in the hot weather, you notice the smell and you do have burning eyes, and we run the air, we open the windows and vents, and by the time we start clinic, we're not noticing the effects of formaldehyde. One thing I'd like to point out is that we retested the trailer, our medical mobile unit, for just 8 hours, which is our work day, and it tested lower. It was still above what EPA recommends for an 8-hour workday exposure, which is 100 parts per billion, but was less than what OSHA recommends for an 8-hour workday exposure, which is the 300 parts per billion. So this is where some of this confusion has come up, is that the 0.3 parts per million or 300 parts per billion is considered an acceptable level by OSHA for an 8-hour workday exposure, but not an acceptable level for long-term exposure in a living environment.
And when you found that you were having headaches and not sleeping well and all of that, and as you understood better what was going on, what did you do about getting people out of these mobile homes that had such high levels of formaldehyde?
This is a real challenge because the cure that is really to get out of the travel trailers, and Mayor Nagin's request that families be sent to their doctors and doctors give them advice about what to do about their formaldehyde exposure is frustrating for me as a healthcare provider, because my advice is to get out of the travel trailers. So that's basically what we've been doing, is just advising people until you can get out, run the air conditioners, don't smoke inside, don't use...
Did you work with other agencies, though, to find them other housing? I mean, if this was a high exposure, and how successful were you in getting them out of these travel trailers?
The rental market in Baton Rouge is extremely tight right now, as is the rental market in New Orleans. And the list of housing that our case manager was able to find in the Baton Rouge area, we managed to find 3 apartments for about 300 families. She also talked with a FEMA case manager. They weren't much more successful. They had about 5 apartments. Catholic Charities has been very helpful in assisting families. They managed to place 367 families last fall. But it's been a real challenge. And so the other real issue here is the fact of the housing shortage.
The question is that I'm concerned about two things. Is one, that this never happen again. And two, what are you going to do to track all of those people that were living in these travel trailers that had the high level of formaldehyde?
This has also been a great area of frustration for me because we want to keep track of our families as they move out so that we can continue providing care to them. What we do is we basically just let them know where we are. They have our phone numbers, but there has not been a data bank to keep track of families that have been in the travel trailers.
Don't you think that would be a good idea?
I definitely think that would be a good idea.
What is it? What do you need to do to make that happen?
FEMA, I've talked to FEMA and they said that they have only kept track of those families that they're still providing rental assistance to. Louisiana Family Recovery Corps is not keeping a list of families that have lived in the travel trailers.
Maybe all of you, excuse me for interrupting you, but it seems to me that you've got several agencies involved and that you might sit down and talk to one another and say, this is something that we really need to do, and begin that process, and who's in charge and who's going to do it, or how are you going to do that in a concerted effort, because it's not okay to say, well, you know, this agency is doing this agency is doing that, and then when you end up, nobody is really doing it.
I agree.
Okay. I hope that happens. And do I have any time left? No.
I agree, because it has been really, really difficult to find out where people are going and follow their health.
Okay. But I think it's incumbent upon all the agencies that are involved to, in fact, do that. I just have a quick question for Ms. Gillette. Why do you think they have trivialized the health problems? I mean, that you brought that up in your testimony.
Oh, I think there's a couple of things. One is I think it was hard for people to believe that this housing was as toxic as it was, because it is stuff that's sold to the general public. And so then there was the issue, well, what do we do about it? And there aren't affordable housing out there. I know people who have loved ones who died in the trailers that they think were killed by the formaldehyde. They're still living in the trailers. They don't have anywhere else to go. But
So what do you see the solution?
Well, the one bigger solution is that you have to reform how the CDC works, and so that it stops, you know, covering for big polluters. It's more interested really in corporate America than it is the health of the people. And that's a big problem. These health consultations that are done across the country almost never find any connection between huge amounts of pollution and people being sick and dying all around there. And so until you change that mindset that, oh, we really just can't prove that all that toxic pollution is causing these people to die, you know, it harms all of us. Because if you have pollution on the Gulf Coast that's not controlled because the ATSDR says there's no connection between the pollution and the health effects, well, guess where you get a lot of seafood from? People all over the U.S. are eating seafood that's contaminated by dioxin and other pollutants.
So I shouldn't eat seafood from the South?
Well, they don't want, you know, the South is not going to want you to say that, but especially the bigger fish you don't want, you know, that magnify the pollution. But my point is, like, when dioxin goes up in the air and it, you know, the whole population of the U.S. is overexposed to dioxin now. We're getting it in our food, we're getting it in our air, and we need to reduce our pollution, and we can't do that as long as we have a federal agency that keeps telling people that pollution doesn't matter, that it's not really harmful.
Ms. Huckabee, I just have one thing. It's not really a question. I am so sorry this happened to your family, and hopefully this won't happen in the future.
Thank you, Ms. Hooley. The fact that things happen in the South doesn't mean that it wasn't Northerners doing it. Mr. Lamson, for 5 minutes.
Thank you, Mr. Chairman. I particularly want to thank you for letting me sit in on your committee, and I want to commend you and Ranking Member Sensenbrenner for the work that you have both done in bringing out these atrocities, and they are atrocities. It's hard to believe that something like this could happen in our country. particularly following a time when so many people have had trauma already. But I just a couple of questions, because most of what I wanted to ask has been put into the record. But let me start with Ms. Huckabee. Many families have to bear the brunt of thousands of dollars of health care costs. I know that FEMA established a program to reimburse for many of the medical bills. Do you know about how much you have spent? Have you asked for that money back? Have you asked for reimbursement? And have you received any reimbursement from FEMA at this point?
No, absolutely no reimbursement. In fact, I heard a rumor that they were doing that. We faxed in all of our medical information, notes from our doctors, and heard absolutely nothing back from FEMA. So if they are in fact reimbursing people, that's brand new news to me.
Thank you. So, think they should?
I believe so. I mean, if it's, if you've got, several doctors saying, look, this was, if not 100% caused, it was definitely made worse. But I mean, I think FEMA's having enough problems coming up with the things that they've already said they're going to do as far as food vouchers and things like that. They haven't got a grasp on that yet either.
Dr. Sinclair, do we know the long-term health effects of chronic formaldehyde exposure? And can the toxicity be passed on to future children and grandchildren of these residents?
We do not know. There have been fairly convincing links to formaldehyde exposure to nasopharyngeal cancer and nasal cancers, and probably throat cancer, lung cancer, and possibly blood disorders such as leukemias. There's conflicting evidence about effects on reproductive health. There were possible correlations from occupational studies that may link formaldehyde to premature births and miscarriages. But again, there haven't been long-term studies of exposure in living environments. There have been cell studies that show that formaldehyde at fairly low levels can be genotoxic and cause changes to chromosomes and breakage of sister chromatids, and may be related to birth defects, but this isn't clear.
Do you know how many people have been involved with these trailers? Do we know that number?
Tens of thousands have lived in the travel trailers.
No, we don't know that. We don't know the number.
FEMA has an exact number of families that have lived in the travel trailers. Yeah, 140,000.
140,000 trailers.
Families. Yeah. At Renaissance Village, which is the largest FEMA trailer village in Louisiana, there have been over 800 families that have moved in and out of Renaissance Village, and the peak population there, estimates range from 1,400, the official number, to about 2,500, the unofficial number, including friends and families that were living with others in the travel trailers.
I thank you very much, and I'll yield back my time, Mr. Chairman.
Thank you, and I thank this first panel. We will now take just a 2-minute break and have our second panel.
Yeah, I think it was like 90,000 in Louisiana. I have one of our brochures. Only built one. You also have to.
husband got a
Because by the court as national counsel. Talk to weeks and weeks.
Thank you. I think we're ready to start back. I would now like to introduce our second panel. Dr. Meryl Karol is a professor emerita of environmental and occupational health sciences at the University of Pittsburgh. She is the former president of the Society of Toxicology and the former secretary general of the International Union of Toxicologists. Dr. Christopher DeRosa is the former director of the Division of Toxicology and Environmental Medicine at ATSDR. The former in his title is now a matter of dispute. As our witnesses should know from having observed the previous panel and from what we've already told them, the oral testimony, the spoken testimony, should be limited to 5 minutes each with some indulgence, after which the members of the committee will ask 5 minutes of questions each. It is again the practice of the subcommittee to take testimony under oath. Do either of you have any objection to being sworn in, to swearing an oath? Okay. You also may be represented by counsel. Are either of you represented by counsel at this hearing today? If you would now please stand and raise your right hand. Do you swear to tell the truth and nothing but the truth? Both the witnesses have taken the oath. Dr. Karol, you may begin.
Chairman Miller, Mr. Sensenbrenner, members of the subcommittee, thank you for inviting me to testify today. In describing my background, I'm a former president of the Society of Toxicology. I was also the Secretary General of the International Union of Toxicologists. This is an association of toxicologists from all 6 continents. Academically, I was Associate Dean for Research and Academic Affairs at the Graduate School of Public Health at the University of Pittsburgh, and currently I am Professor Emerita of Environmental and Occupational Health Sciences at the university. I wish to stress that my testimony today reflects only my opinions. As a toxicologist, I have conducted research for 34 years on mechanisms of chemically induced lung and skin diseases. I have conducted research on formaldehyde, focusing on allergic sensitization following both skin and lung exposure. This research was supported by both the NIEHS and by NIOSH. I have published nearly 200 scientific articles, books, book chapters, and monographs. Particularly relevant is a 2007 monograph entitled Improving Indoor Environmental Quality for Public Health that discusses effects of indoor environments on human health. In the brief time that I have available today, and it will be 5 minutes, I would like to comment on one of the major recommendations of the ASTDR February 2007 Health Advisory. Specifically that 0.3 ppm concentration of formaldehyde be designated a level of concern for sensitive individuals. A level of concern being defined as a level above which individuals with hypersensitivity to formaldehyde would suffer adverse health effects. In my opinion, this level has to be lowered. In outdoor air, formaldehyde is normally present in concentrations around 0.002 parts per million. Indoors, the concentration is typically 10 to 20 times higher, depending on various factors such as construction materials, furnishings, the age of the housing, with newer homes typically releasing more formaldehyde by off-gassing. Heat and ventilation also affect the formaldehyde concentration. Most people can detect the presence of 0.5 ppm formaldehyde by this in high concentrations. It typically causes eye, nose, and throat irritation with symptoms of eye tearing or perhaps eye, nose, and throat burning, hoarseness, cough, difficulty in breathing. However, formaldehyde can be irritating at a concentration that is even lower. A percentage of the population develops eye irritation when exposed to a concentration below the odor threshold and around the 0.3 stated level of concern. Sensitive individuals may have adverse effects when exposed to yet lower concentrations. Such individuals would include those with hyperreactive or twitchy airways, those with underlying disease, or with a viral infection of the lungs, among other concerns. Infants and the elderly would reasonably be expected to be more responsive to irritants such as formaldehyde, The narrower airways make children more susceptible than adults to agents such as irritants that cause airway constriction. The ATSDR proposal of February 2007 suggests 0.3 ppm formaldehyde as a level of concern for sensitive individuals. The basis for this proposal was the OSHA guideline for acceptable workplace exposures, with a maximum of 0.7 ppm formaldehyde averaged over an 8-hour work shift. It must be emphasized that the OSHA permissible exposure is an occupational standard established for healthy adults expected to have only an 8-hour exposure. In order to apply this guideline to indoor environments that would be safe for a general population, one must lower the permissible concentration because the population is diverse, not only with respect to age, but with respect to underlying health status and concurrent environmental exposures, and they may be exposed for 24 hours a day. 10 years ago, a review was published that critically looked at 150 scientific articles on formaldehyde and concluded that eye irritation occurred at 0.24 ppm in about 20% of the population, and these are non-sensitive subjects. The authors of that article concluded that an indoor environment where exposures might occur 24 hours a day should maintain a concentration of formaldehyde below 0.1 ppm, and that would protect virtually all persons. So in summary, to protect residents against adverse effects from formaldehyde inside their trailers, guidelines must take into consideration the diversity of the exposed population, as well as the diversity of the indoor environment, including the temperature, ventilation, furnishings, and other chemicals. The suggestion that 0.3 ppm be designated a level of concern for formaldehyde might protect non-sensitive individuals, but it would not protect those that are sensitive. The level of concern should be lowered and should not exceed 0.1 ppm. Uncertainty remains regarding the likelihood of chronic health effects resulting from continued formaldehyde exposure in trailers. And for this reason, the level of concern has to be revisited periodically. Thank you.
Thank you, Dr. Karol. Dr. DeRosa.
Good morning, Chairman Miller and Ranking Member Mr. Sensenbrenner and other distinguished members of the subcommittee. I am Chris DeRosa. I have been working for the federal government for 28 years. Today I will respond to the issues posed in your letter of invitation dated February 27, 2008. I would like to note for the record that I am not here as a representative of ATSDR, but rather as an individual. I would also like to emphasize that my remarks today and other stated concerns should in no way be construed as a reflection on many of the highly talented and motivated, well-intentioned staff of my agency. I served as the director for the Division of Toxicology and Environmental Medicine at ATSDR from 1991 until 2007. I have a degree in ecology, master's degree, and a PhD in biology from Miami University of Ohio, and have held academic appointments at the Universities of Virginia and Maine over a period of 10 years. Before coming to ATSDR in 91, I worked for the EPA's Office of Research and Development for 10 years as branch chief and then acting director of the Environmental Criteria and Assessment Office. I am an author or co-author of over 200 peer-reviewed publications and have served on the editorial review committees of over 10 professional journals. I've been a charter member of the World Health Organization's Steering Group for Risk Assessment since 1994. I'm a member of the American College of Toxicology and one of 180 elected fellows of the Collegium Ramazzini. The mission of ATSDR is to serve the public by using the best science, taking responsive public health actions, and providing trusted health information to prevent harmful exposures and disease related to toxic substances. There are a range of activities that ATSDR undertakes as a response to the health mandates outlined in the CERCLA or Superfund legislation. One of these is a health consultation developed as a formal response to time-sensitive issues, as was the case in the aftermath of Hurricane Katrina. Following the agency's initial response to this tragic event, ATSDR was also engaged in ongoing verbal and written evaluations and discussions for a wide range of information on behalf of EPA and FEMA. These included the evaluation of formaldehyde levels in the air of unoccupied FEMA trailers. In contrast to a health consultation, such evaluations are more informal, usually verbal, periodic discussions of available data as it emerges. Initial discussions regarding sampling protocols and data collection of formaldehyde in trailers used by EPA are used by FEMA and analyzed by EPA began in June of 2006. Because of the sensitivity of emergency events and preparedness and other coordination activities, I began a series of weekly reports in 1999 for all senior staff, including senior agency leadership. These reports summarized significant events in these often time-sensitive programmatic areas, and the details that we provided regarding the work we did in support of EPA and FEMA were frequently included in these reports. In early December 2006, Dr. Howard Frumpkin stated to me I had not kept him adequately informed of the fact that we were evaluating samples on behalf of FEMA that were collected by EPA. I advised Dr. Frumpkin that this was a routine collaboration that has occurred between ATSDR and EPA over a period of 25 years, especially dealing with time-sensitive events of environmental contamination. Dr. Frumpkin requested that his name be deleted from the mailing list for these weekly reports in September of 2007 because he found them to be unhelpful. In early December 2006, my division's emergency response team, ERT, were asked to provide an evaluation of EPA's sampling data regarding the levels of formaldehyde in unoccupied trailers. Dr. Frumpkin was aware of this evaluation as early as December 4th, 2006, at the specific direction of FEMA, its attorney for the Office of Legal Counsel. My division's ERT did not share the evaluation through the usual division review and approval channels. Instead, they provided the drafts of the consultation to the Director's Office of Preparedness, Terrorism, and Emergency Response, OPTER. This was done without my knowledge, and I was unaware of the role of Dr. Frumpkin's office in the oversight of this effort until summer 2007. It was through this channel that Drs. Frumpkin and Sinks provided review and comment on the draft. During the period between which, is this indicating my time is up, Mr. Chairman? Okay, thank you. Okay, thank you, I appreciate that. This was done without my knowledge, and I was unaware of the role of Dr. Frumpkin's office in the oversight of this effort until summer 2007. It was through this channel that Drs. Frumpkins and Sinks provided review and comment on the draft consultation. During the period intervening between the point at which the sampling data was provided to my division's ERT and the release of the consultation to FEMA on February 1st, 2007, Drs. Sinks and Frumpkin provided review and comment on the draft consultation. During this period, at no time did I have any contact regarding this effort with either FEMA or EPA. The health consultation was forwarded to FEMA February 1st, 2007. I was unaware of this until receipt of the health consultation on February 27th, when a copy of the report appeared upon my desk. After an initial review of the consultation, I immediately contacted Dr. Frumpkin's office by telephone and email to state my concerns regarding the limitations of the consultation. I stated the report failed to address longer-term health effects, especially the issue that formaldehyde is a carcinogen. That same day, I sent a second email transmitting a proposed amendment to the consult to address these longer-term health concerns. After repeated requests to issue an amendment to the original consult, I was directed by Dr. Frumpkin to forward my proposed response to Dr. Mark Keim, then acting director of OPTER. At this point, I concluded that the lead for this effort resided solely within the office of the director, specifically the Office of Preparedness, Prevention, and OPTER. I had no further involvement with the FEMA consultation until late June 2007, when there was a briefing for congressional staff regarding this issue. However, in the interim, I repeatedly cautioned Dr. Frumpkin and other senior staff regarding the issues confronted by the agency in this matter. For example, on June 1st, I wrote to Dr. Frumpkin outlining my concerns in response to a request from FEMA to identify quote-unquote safe levels of exposure to formaldehyde.
Dr. DeRosa, if you could summarize your remaining testimony.
So despite the repeated efforts to bring these issues to the attention of my management, we had very little constructive follow-up effort. I recommended that we use the health guidance values in the toxicological profile for formaldehyde as a point of departure for any discussion regarding safe levels. This was after repeated requests from FEMA to restrict our evaluations to short-term exposures. I did state that as our efforts went forward, that health interventions must be pursued to address the clinical manifestations of acute formaldehyde toxicity. I stated that such clinical signs were a harbinger of a pending public health catastrophe that may be transgenerational in its impact, and I stressed the importance of alerting residents to the potential reproductive, developmental, and carcinogenic effects of formaldehyde. The response I received was that such matters should not be discussed in emails since they might be misinterpreted.
Thank you. If you have anything further,
I think I would simply close by saying that I know that this has been a complicated matter for everyone involved, that there are often no straightforward answers to complicated situations. However, I think that we need to invoke the maximum public health practice articulated by Bernardino Ramazzini 4 centuries ago, that it is better to prevent than cure, and that the precautionary principle should be invoked in matters of this nature. Thank you.
Thank you, Dr. Frumpkin. The chair now recognizes himself for 5 minutes, and the chair may call time, but the chairman will try to do it more gently than to sound a horn to let either members or witnesses know that their time has expired. Dr. DeRosa, it does appear that there was testing at various points, first by the Sierra Club, then by FEMA, that there were different standards for safe exposure or concern from exposure, and that this particular exposure didn't fit neatly into some standard. But based upon the testing that had already occurred by February of 2007, and despite the fact that there wasn't a specific standard in existence for these particular circumstances, do you think that the ATSDR and CDC knew enough in February 2007 to know that there was something to worry about?
I think that the reports in the media and elsewhere were strikingly consistent with the health effects of formaldehyde. I felt that the level that had originally been used was not an appropriate level, that the levels I referred to just recently were many times lower than that, 0.008 parts per million if people were going to be there for a period of a year or longer. Less than that, perhaps 0.03 parts per million. Those would have been the values that I would have insisted be included in such a consultation as a point of departure, looking at the other parameters that may govern exposure and the health effects of formaldehyde in the situation presented by the trailers.
Dr. Karol, do you have anything to add on that topic?
Yes, there are other agencies in other countries that have established guidelines for safe indoor air. One of them is the Canadian health concern, and they established 0.1 ppm as safe for indoor air. WHO recommends a level of 0.12 ppm, so these are all very consistent. that this should have been the safe level and that this should have been measured in the trailers to see what the levels actually were.
Thank you. Dr. Frumkin, you said in your testimony that you were not here excuse me, Dr. DeRosa, you said in your testimony you were not here testifying on behalf of ATSDR. I do think that is abundantly clear. In the early stages of our investigation, there was some suggestion that there was actually a conscious effort to exclude you from the review chain for the report, and your superiors adamantly deny, and because they knew what your position would be, your superiors adamantly deny that is the case, and they say that they put into place expedited review procedures because of the urgency surrounding Katrina and Rita, and I certainly applaud the government trying to act quickly on its feet when circumstances require that. But were you part of the? Did you design the review procedures that excluded you, that did not include you in the review?
No, I did not.
Okay. Did you review this report?
I did not review the February 1st consultation at all.
And when did you first see it again?
February 27th.
And how quickly after that when did you do something, if ever?
Upon reading the report, I called the office of the director. I spoke with personnel there and indicated that we had a significant issue with this document because it was incomplete and perhaps misleading. I followed that up with an email to that effect. I then rapidly drafted a proposed amendment pointing out that there was a concern regarding the longer-term health effects that same afternoon, and that this was a letter that could be forwarded over my signature or forwarded over anyone's signature for that matter to amend our initial consult.
I understand that your superiors both at ATSDR, both in their interviews with our staff and in their expected testimony later today, will say that you're responsible for the work of your team, even though it was not directly reviewed by you. Do you have a response to that?
In fact, that was the reason I was most concerned in my initial review. I felt that our internal procedures governing the review of any division document had not been followed, and that this is why the consult turned out as it did. I later learned that that was not the case. I later learned that this was being dealt with in the aftermath of Katrina, where staff were tasked as needed, independent of a given management chain, to provide the needed input on a consultation or other evaluation. Typically, this would have gone through several levels of review prior to that. Not knowing the involvement of Dr. Frumkin and Sinks at the time, I did meet with my staff to reaffirm our standard operating procedures in clear terms, and didn't learn about the other aspects of the review and clearance process prior to summer of 2007.
In the last few months, it's apparent that your superiors at ATSDR have grown to view you as a problem employee. But I know that the federal employment system has incentive bonuses for the best employees to keep them in federal employment. Have you gotten one of those in the past?
In 2006, I received a very substantial and generous bonus and salary raise based on my performance.
And how much was that?
It was 5% of my salary as an increase, I believe, and a $10,000 bonus.
And that was the most recent review before the one at which you were found to be so lacking?
It was.
Okay. For both Dr. Karol, the chair now warns himself that he is over his time. It does appear that the conduct of ATSDR in issuing the report in February of 2007, and then failing to act with some urgency when it was very clear that FEMA was continuing to tout that report as authority for their needing to do nothing more than what they were doing, may have delayed, very well have delayed moving people out of the trailers for a year. Some people have been in the trailers for 2.5 years, some people much less. How much can we calculate or estimate what difference it might make for the families, for children, for pregnant mothers, for the older folks, to have had an additional year of exposure to formaldehyde fumes? Dr. Karol.
The important thing to do now is to track those people, to get good records, and to have a health assessment so that you've got good data to evaluate in the future. And it's difficult to evaluate what the effect might have been. But right now what you can do is to track the people, get them evaluated, and get the trailers evaluated as well.
Dr. DeRosa.
I would agree. I think that what we refer to as a health registry of those individuals who had been exposed throughout that period should be instituted to the extent that it can be, so that the people can be followed through time, because we know many of the effects that Dr. Karol referred to have a latency of 10 to 20 years. And so this is something that may not manifest itself for a period of time. We do know that people have already been clearly affected by the reports of sensitization and as well as the other classic signs of acute formaldehyde toxicity.
The chair's time has expired. The chair now recognizes Ms. Eddie Bernice Johnson for 5 minutes.
Thank you very much, Mr. Chairman. Dr. DeRosa, the mission of your agency is to be protective toward the public with scientific information, isn't it?
Yes, ma'am.
Do you feel confident that your agency is fulfilling that mission?
I believe that there are many ongoing efforts that meet that criteria of protecting the public's health. I believe in some areas, and again, I'm speaking personally, not for my agency, that perhaps a more precautionary approach could be taken in dealing with the uncertainties that surround many of these types of unfortunate incidents that occur throughout our country and elsewhere.
Is there a procedure by which once information is gained and it lends itself to being rather negative about what's going on, how is it received by the leadership of the agency?
There have been many instances in which such concerns have been raised and have resulted in the development of health alerts that are, again, developed in coordination with other agencies and placed on our website and duly noted. In other instances, there seems sometimes, I would suggest, a reluctance to deal with things such as multiple chemical sensitivity. My own view is that we should be addressing this issue, agreeing on what we know, agreeing on what we don't know, and identifying how to deal with the latter.
When you arrive at a position to feel that there is some question about the effects of an environment or whatever, and perhaps a person's exposed need to be tracked, how is that handled?
Generally speaking, when we have a group of individuals that have been exposed, we will attempt to follow those individuals through time to identify subsequent health issues that they may experience.
Do you know whether or not this has been instituted with Katrina victims?
To my knowledge, it has not been, but I believe it is being considered, and I would think that it would be an appropriate path forward.
Well, thank you very much. Dr. Karol, being an expert on toxicology, I noticed that you just mentioned that some tracking would probably bring forth future information. Do you feel that your consultation with the ATSDR has been useful?
Well, I think that there has to be a systematic approach in the future to document who's living in the trailers, what the conditions are, what are the other exposures in the trailer, and what are the health concerns. I think that's absolutely essential to go forward.
Thank you, Mr. Chairman.
Thank you, Ms. Johnson. The chair now recognizes not a member of this committee, but the chairman of the Environment and Energy Subcommittee, Mr. Lamson.
Thank you, Mr. Chairman. Dr. DeRosa, have you been left out of reviews and other times, other circumstances that you can recall?
I have not had further involvement with the ongoing activities regarding formaldehyde in trailers issue, nor with what was referenced earlier as the report on the Great Lakes, 26 areas of concern. I've had very limited involvement since October with reviews of that nature.
What about before that? Were there other times that you were left out of a review?
It's hard to know if one has been left out of a review, but that's certainly possible. But, I would not be aware if I'd been left out.
Generally, how have you been treated of late in the agency?
My experience in the last period of months since October have been complicated. I have been removed from my position, as I mentioned, as the director of the Division of Toxicology and Environmental Medicine. I have limited opportunity to interact with my peers in terms of technical exchange due to my physical relocation on 3 different instances since October and December and February. I have been put on a performance improvement plan as of February 21st, as I recall, 90-day period, after which my performance will be evaluated.
I have a loss of words to follow that comment, so let me switch. You indicate that you requested that health interventions be pursued to address the clinical symptoms that people were experiencing. Are there protocols at ATSDR in place for dealing with emergency situations where people are experiencing health effects and some intervention is needed immediately?
There are, but I would have to point out that ATSDR is an advisory and not a regulatory agency, though we do serve in an advisory capacity to organizations such as FEMA and EPA. And there are things that have been done in the past, for example, providing alternative drinking water supplies to communities whose water has been contaminated. There are also a range of health education activities that can be pursued that people can readily invoke that represent relatively low-hanging fruit. And generally speaking, when people are given appropriate information, they act in the interest of their health.
How typical, I guess that's what I'm trying to understand, how typical this situation is or has been at your agency. It seems poor science was converted to poor information and the result was inaction. And I'd add that the process took far too long to provide an emergency response. So how do we fix this?
The initial response of the agency was very proactive. We had individuals deployed in the field prior to Katrina. We had stood up the range of resources available to us, and had participated extensively in some of the initial triaging of people that were affected by Hurricane Katrina. I think the issue becomes what happens in the longer term aftermath of these events. What do we do to take into account that something that happens in a very short time frame for a very at an extended level of exposure perhaps, how do we track those individuals longer term to understand what the longer term consequences might be and what interventions might be pursued to minimize any consequences of those acute exposures?
Are you aware whether or not any of this can be passed on to future generations?
Well, I did say that there were potentially transgenerational impacts. That meant, in my mind, that the developing fetus may well be affected by this, that there may well be reproductive developmental outcomes that would be evident in the children, perhaps not yet born. That is an area in which there's some scientific debate. It's important to note that while the debate occurs, that these reports have been described as inconsistent as opposed to contradictory. Inconsistent means that because of the variable nature of the different studies that have been done, different findings will be reported by different studies at different points in time using different protocols. But the International Agency for Research on Carcinogens, for whom I also consult on occasion, has indicated that the evidence in this case is suggestive but inconsistent.
My time has expired. I have other questions also been for the record. I think that it would be, I want to say that we appreciate the service that you have given to us and your willingness to stand up and speak about the things that you believe so strongly in. We need more people like you, not fewer. Thank you very much. I'll yield back my time.
Thank you. Just one question of clarification. Dr. Karol, the reason we have asked you to be part of this panel is that you are obviously an expert in toxicology, and you are not involved in this in any way. And we expect you to be a neutral witness. You don't have a dog in this fight, except the public health generally. When you reviewed the February 2007 health consultation, how much research, how much thought, how apparent was it to you was required? How apparent was it to you that there were some deficiencies in that consultation?
The best way to answer that is to say that after I read that consultation, I immediately went into the literature to see what else was known, because it seemed insufficient as far as its coverage of long-term chronic effects and as far as its coverage of sensitive asthmatic individuals, hypersensitivity, allergic sensitivity. So that, I think it could have been done in a much more thorough manner, and it should have been done. There's a lot in the literature as far as reviews from the National Research Council, from the WHO, from numerous groups that have looked at formaldehyde as far as long-term consequences. And I don't think that's reflected adequately in the ATSDR document.
Well, I'm not quite clear. Did you put the consultation down and say, well, that sounds right, but let me do a little research to see what the other literature says, or did you put it down and say, and think to yourself, this just doesn't ring true?
Well, parts of it, I said, there's got to be more than this, and this isn't what sounds right to me, and that's why I went into the literature. Parts of it, covering the acute effects, I think they tried hard to look at what was known, but did not do a sufficient job. So I think it really falls down in the area of chronic effects, possible reproductive effects, possible carcinogenesis, and so on.
Dr. DeRosa, I want to join in. You can relax. I don't have any more questions. But I want to join in what Mr. Lampson has said. It is not second nature for many managers to value whistleblowers. There is some tendency to see them as insubordinate, as disloyal to their superiors. But the loyalty we expect is a loyalty to the mission of the agency, the loyalty to the mission to protect the public health. And we appreciate your willingness to step forward and say that when that you think that the agency is not faithfully serving that mission. So we do value, we do appreciate whistleblowers, and would be deeply disappointed if you had adverse employment consequences as a result of blowing the whistle on conduct that we needed to know about. You may. You don't have to, but
Just
you may.
briefly, I would comment that in struggling with what was a dilemma for me in pursuing this issue, I referred to a plaque that hung on my wall that was a pledge to the citizens of the United States by the CDC at that time in 1990. One of the elements, 5 elements, was that we will put the benefits to society above the benefits to the institution. And so that's what I tried to do.
Thank you, Dr. DeRosa. We've now completed this panel. We will again take a 2-minute break before beginning the next panel. Thank you.
Yes, ma'am. Of ATSR is mandated by technically I probably
All right, we are back in session, and I'd now like to welcome our third panel, our final panel. Dr. Howard Frumkin is the director of the National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry of the Centers for Disease Control, the ATSCR. Dr. Frumkin is joined by Dr. Tom Sinks, the deputy director at the National Center for Environmental Health at the ATSDR. And our final witness is Vice Admiral Harvey Johnson, Jr., the Deputy Administrator of the Federal Emergency Management Agency, FEMA. You each have 5 minutes for your spoken testimony, your oral testimony. Your written testimony will be included in the record. When you complete your testimony, we will begin with questions, and each member will have 5 minutes to question the panel. It is the practice of the subcommittee to take testimony under oath. Do any of you have an objection to swearing an oath, to being sworn in? You also may be represented by counsel. Do any of you have counsel at this hearing today? The witnesses have all said that they do not object to swearing an oath, and they have no counsel with them. Would you please now all stand and raise your right hand? Do you swear to tell the truth and nothing but the truth? Thank you. The witnesses have all entered into the oath. Dr. Frumkin, I understand that you will be reading a joint statement for yourself and Dr. Sinks. You may begin.
Good morning, Chairman Miller, other distinguished members of the subcommittee. Thank you for the opportunity to be here today. I'm Dr. Howard Frumkin, Director of the Centers for Disease Control and Prevention's National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry. I'm accompanied, as the chairman said, by Dr. Thomas Sinks, Deputy Director of NCEH-ATSDR. We share with the committee a firm commitment to strong science, to public health protection, and to good government. We recognize the need to be accountable. Perhaps most importantly, we know that the tens of thousands of people throughout the Gulf region who suffered through the 2005 hurricanes and then lived for too long in structures not intended for long-term residents deserve our very best. We've accomplished a great deal in protecting public health, and I welcome the opportunity to describe our work. I'll do so in 3 parts. First, in our overall response to Hurricanes Katrina and Rita, we did a great deal to protect public health. Hundreds of CDC and ATSDR staff were deployed to the Gulf region, and hundreds more back in Atlanta supported their work. Setting aside our general public health work and focusing on environmental health alone, we helped restore safe drinking water and safe food. We helped evaluate all Superfund sites in the damage zone for hazardous conditions. Excuse me. We mapped and assessed industrial facilities to identify hazards. We protected the public from carbon monoxide poisoning linked with generator use. We investigated mold in buildings and protected the public from that hazard. We assessed hospitals, clinics, schools, and other facilities and cleared them for re-entry as appropriate. And we assessed dozens of sets of environmental sampling data for health risk. Our work was extraordinarily effective and successful in protecting public health. Second, with respect to the specific focus of today's hearing, formaldehyde exposure in FEMA-supplied trailers and mobile homes, as I've previously acknowledged, our initial work could have been better. In retrospect, there were indications of a formaldehyde problem as early as the first half of 2006, and we could have engaged the issue earlier and more aggressively. Our initial work product, our February 2007 report on formaldehyde in unoccupied trailers, was narrowly focused, used an inappropriate level of concern, and did not deliver a sufficiently clear and complete public health message. The steps we took to rectify the report, while ultimately successful, took several months to complete, longer than they should have. Our initial formaldehyde work did not meet our own standards of excellence. We've carefully reviewed the factors that contributed, and we've taken concrete corrective actions. Some were immediate. For example, since irregular communication between FEMA and our agency contributed to the problem, we clarified with our own staff and with FEMA the appropriate channels of communication. Other corrective actions are ongoing. A review by our expert external board of scientific counselors of our scientific clearance procedures, an external review of our management procedures. I regret that our initial work on formaldehyde in trailers did not meet our own expectations. I'm confident that we've learned important lessons, that we're acting on those lessons, and that we will be an even stronger, more effective agency moving forward. Third, I wish to update the subcommittee on our ongoing work on formaldehyde in trailers. Our portfolio is broad and deep. Our study of 519 occupied trailers, whose results are shown on the graphic, provide the most solid evidence to date that formaldehyde levels were high. These data led to action: FEMA's decision to relocate trailer residents to more permanent housing and to discontinue the use of travel trailers. Our study of trailer structures with Lawrence Berkeley Laboratory is examining what features of trailers contribute to formaldehyde emissions. Our remediation study with NASA is examining technologies that could lower formaldehyde levels. Our clinical record review of children in Mississippi will help clarify respiratory health implications of the hurricane aftermath, including living in trailers. A long-term cohort study of children who resided in trailers will yield extensive data on the health implications of that experience. We will work with FEMA to create a registry of trailer residents to facilitate follow-up and tracking over time, as was discussed in the earlier panels. Our expert panel continues to meet to review our science and to advise us on our work. Our extensive communication effort continues our outreach to the public with health information. We're updating our toxicologic profile on formaldehyde, and we have engaged other agencies to move toward long-term coordinated approaches to safe, healthy, manufactured housing. This is a record of active, sustained, successful protection of public health. We share with the members of the subcommittee a common goal: to serve the public and to bring to bear the best science in doing so. As public servants, we are accountable for achieving this goal. I'm very proud of our overall efforts to protect public health following Hurricanes Katrina and Rita, including our more recent efforts related to formaldehyde. I recognize that in some respects we could and should have done better. We welcome the oversight of the committee as we strive constantly to improve, and we stand ready to cooperate as we move forward. Thank you.
Thank you. Admiral Johnson.
Good morning, Mr. Chairman Miller, Congressman Lamson, members of the committee. I'm Harvey Johnson, the Acting Deputy Administrator and Chief Operating Officer of FEMA within the Department of Homeland Security. I'm here this morning, Mr. Chairman, to assure the committee that FEMA has taken responsible steps to address some concerns regarding the presence of formaldehyde in temporary housing units. I'd like to do this by making three principal points. First, the health and safety of temporary housing occupants is of paramount importance to FEMA. One of our primary missions is to provide individual assistance to disaster victims and communities, and members of the FEMA team, many of whom are disaster victims themselves, take this very seriously. Since March of 2006 to the present, we've investigated each instance where an occupant reported concern due to formaldehyde, and we sought to find a remedy by swapping out the housing unit or relocating the family to a rental housing unit. FEMA has been aggressive to search within communities to find available housing options, which sometimes have been rare, to offer current occupants mobile homes and travel trailers. We've been seeing in the population of households, the temporary units dropped from a peak of almost 143,000 units to now just over 30,000. Since February 14th, release of the preliminary findings, FEMA has prioritized relocation of those occupants who have expressed a health concern, those who are most susceptible to health risks such as elderly, the households with young children, and those with respiratory challenges. That category is comprised of just over 12,000 households. For current and future disasters, FEMA will test the level of formaldehyde in every unoccupied unit prior to deployment and provide the certified results to the state as well as to the occupant. FEMA will deliver the units that are determined acceptable by the state. FEMA has also updated specifications for purchases of new manufactured housing units and park models to be more stringent on air quality. Second is that FEMA has been completely transparent on this issue. FEMA sought to ensure that the occupants of temporary housing units have access to all of the available information about formaldehyde. We've established and still maintain an open call center where callers can talk to FEMA or to a representative from the Center for Disease Control. We maintain a website that provides access to all current formaldehyde information. And we've distributed flyers to occupants on 3 separate occasions, informing occupants of the symptoms associated with formaldehyde exposure and suggesting actions they can take to reduce formaldehyde levels based on guidance from public health officials at the time. FEMA has provided more than 20,000 pages of documents to Congress, including this subcommittee. We've provided similar information to the Government Accounting Office, to the Department's Office of Inspector General. Our staffs have met with congressional staff and various investigators on numerous occasions. FEMA has hosted meetings and provided information to various advocacy groups to ensure transparency of FEMA's actions regarding formaldehyde. And finally, FEMA recognizes the importance and significance of this issue and is intent on becoming part of the solution. FEMA recognizes our limitations as well. We're not a public health agency, and frankly, we're not a long-term housing agency either. We've sought medical and environmental assistance from the very beginning, engaging with the Environmental Protection Agency, the Department of Health and Human Services, the Center for Disease Control, and the Office of Health Affairs within the Department of Homeland Security. Even today, we engage with all or some of them every day in our shared desire to best meet the health and safety challenges of disaster victims. We've tried to be a smart consumer of their advice and have tried to implement that advice in a practical settings of a disaster site. We've made some mistakes along the way, all of us have, but it has occurred as the act has been in the service of providing assistance to disaster victims with the best of intentions, and we've all learned and gained a significant knowledge along the way. At no time has FEMA ever turned from the challenge because of concern for litigation or a thought that we might be criticized for our actions. We've also tried to learn more from the challenges. For example, we're working right now with a temporary housing manufacturer and believe that our public-private cooperation will lead to a temporary housing unit at extremely low levels of formaldehyde, and that these new units will be available for the upcoming hurricane season. And importantly, Mr. Chairman, FEMA shares the objective of this committee that our collective efforts to examine this complex issue will result in better policy and greater awareness and more consistent assurance to the public, more specifically to current and prospective disaster victims, that FEMA and our federal and state partners can better ensure their health and safety. I'm pleased to answer any of your questions, sir.
Chair now recognizes himself for 5 minutes for initial round of question. Admiral Johnson, this is not the only committee or subcommittee of Congress that has looked at the trailers provided by FEMA. In documents produced to other committees, either the Government Reform and Accountability Committee or the Homeland Security Committee, documents from FEMA show that FEMA employees were warned about formaldehyde in trailers. Is that correct?
What's correct, sir, is that from 2005, Bechtel Corporation asked, as a matter of routine, to conduct assessments for formaldehyde in travel trailers. That was done in 2005. That was a Bechtel effort that was really not made aware to FEMA. Also in 2005, that was just a few months after Katrina, where there were hundreds of thousands of families without any type of housing. And so we were still in the initial stage of providing housing, and that issue did not come to our attention. It did not rise to the level of decision makers' attention in 2005. In 2006, we became aware by the first reports in Mississippi by occupants who were reporting problems in formaldehyde. And at that point on, I think, without going through the timeline, I think you'll see that FEMA reacted to every one of those reports. We began consulting with EPA, with CDC, with others, and sought medical advice, and I believe we've taken responsible actions based on that medical advice over the last 2 years.
The documents included an email March 22nd, 2006 from Bronson Brown to Richard Sees, Owen Motter, and David Shawaga that said staff are to be instructed that prior to entering the trailers, there should be a period of time for off-gassing before conducting any work operations inside the trailers.
That's correct. The gentleman who wrote the email is our head of occupational health safety in FEMA. And the trailers he was referring to were unoccupied trailers that had been closed and sealed for some amount of time. Those were not occupied trailers by disaster victims. And so it is when those trailers have been sealed in the heat, we do want to make sure that our employees take the proper precautions to ventilate those units before they go into them.
And how long would be the period of exposure by a FEMA employee entering a trailer to do some work?
Well, those are workers who, in this case, were either preparing trailers to be occupied or were preparing trailers to be sent back, had been already used, and prepared them to be disposed of in some manner. And so they would usually be in those for short amounts of time.
Dr. Frumkin, turning your attention to the February 2007 health assessment. Do you know who it was at FEMA who requested that health assessment?
My understanding it was Mr. Preston in the counsel's office.
And you know the purpose of the assessment?
We understood that it was a request for a review of data in terms of its health implications, a fairly standard kind of request.
Was it for purposes of acting to protect the safety of the occupants, or was it tied to any pending liability?
I'm not aware of any liability issues at the time, although in retrospect, there have been documents that we've seen that demonstrate that concern.
Well, there was a email from Dr. Sinks on October 12 of last year, 2007, that said, unfortunately, the request was generated by FEMA lawyers attempting to respond to legal actions against FEMA. Were you aware of that email?
I think in retrospect, one of the issues that we could have done better was to have recognized the significance of a request from an attorney. That's an irregular form of a request, and we could have flagged concerns with that to the agency.
Okay. Is it your practice to provide expertise to lawyers involved in litigation?
No, sir. It's our practice to provide expertise to sister agencies that request that expertise. We didn't, in this case, recognize that this was a different sort of request from a sister agency than the usual one.
Second round. The initial email to you, well, first of all, could you describe the chain of review for the February health consultation provided to FEMA, February 2007 health consultation provided? Were you in that chain? Who else was in that chain?
The ordinary chain of review that prevailed at the time and that was used across all of our divisions was as follows. A product would be developed by staff in the division. It would move up through the division leadership, and then in some cases, usually on a discretionary basis, be brought to the attention of center leadership. There was also an accountability to the Emergency Response Office, as Dr. DeRosa explained earlier, but that didn't replace, that simply supplemented the standing line of review.
I'm sorry, was there a separate emergency response chain, or were there different procedures for emergency responses?
The baseline procedure was the one that usually prevails, and that is that staff within a given division would move their documents, their work through their division for clearance. In addition, because of the complexity of the Katrina work and the fact that all of our divisions were involved, we had created a sort of a central point of information and contact in the Emergency Response Office so that documents were moved up that chain as well.
Well, I'm sorry, I'm still not quite understanding. Which procedure was used with respect to the health assessment in 2007, February 2007?
What we've learned in retrospect was that the clearance within the division did not occur as it ordinarily would and should have. So the staff went directly through the emergency response chain, and that was the only chain that they used.
And you were part of that chain, that's correct, is it not?
After the review in the Emergency Response Office, it came to the Office of the Director, yes, sir.
Okay, and when did you, and I have an organizational chart that shows that the chain appears to consist of Marilyn DeSorio, Nabil Issa, Mark Keim, K-E-I-M, Gina Motri, Linda Anderson, Tom Sinks, and you. Would those be the people in the chain?
No, sir. Those are various associate directors within the Office of the Director. The specific person who was part of the emergency response chain was Dr. Keim. He would report directly to Dr. Sinks and to me.
Who would?
Dr. Keim.
Dr. Keim, okay. And when did you learn that it had not gone by Dr. DeRosa for review?
In late February, when Dr. DeRosa contacted me with his concerns, I was surprised to realize that he had not had a role in overseeing his staff in preparing the report.
You did not know before that time that he had not seen the review, the assessment?
No.
Dr. Sinks, you're in that chain as well. Did you know in February 2007 that Dr. DeRosa was not in the chain?
Absolutely, I did not. Dr. DeRosa called me, stated that he was informed that that his staff had been instructed not to share the document with him on orders from the Office of the Director. I commented to him at the time that those instructions never came from the Office of the Director. He then went back, spoke to his staff, and sent a second email which included the letter that he recommended be sent forward to FEMA, which about 10 days later we did send forward.
Is your recollection now, well, Dr. Sinks and then Dr. Frumpkin, the same question, is your recollection now different from when you were interviewed by our staff about all this?
My recollection is not. I think I've been very consistent in speaking to your staff for more than 6 hours on this issue, and I think I've said the same information.
Dr. Frumpkin, is your recollection the same now as it was when you interviewed with our staff?
If there's a disparity, I can't recall it, no.
Okay. And is it correct that the emergency response procedures would have gone directly from whatever employees were involved in developing the assessment to Dr. Keim, to Dr. Sinks, to you? And would not the emergency response procedures did not include Dr. DeRosa?
I'll try to handle that. There is a small group in Dr. DeRosa's division, which is an emergency response team, which under the National Contingency Plan, and Dr. DeRosa is our representative under the National Contingency Plan, does operate. It operates independently of our emergency response group that coordinates things in our Office of the Director. They do report to a team lead. That team lead reports to a branch chief, and ultimately that branch chief reports to Dr. DeRosa. Those individuals were informing their chain of command of the work they were doing since June of 2006 in weekly updates. Dr. Frumpkin became aware of the work they were doing in December 4th of 2006 and sent Dr. DeRosa an email at that time specifically asking Dr. DeRosa to keep us informed and to update us routinely at our senior staff meeting, which occurs once a week.
I understand that the employees involved in preparing the assessment have told our staff in extensive interviews, probably every bit of 6 hours, that the ordinary procedure for the emergency response, and they understood that this was subject to the emergency response procedures, went directly to Dr. Keim. That's different from what your understanding is? And that routinely, with respect to emergency response, it did not go back past Dr. DeRosa. It went directly to Dr. Keim, to Dr. Sinks, to Dr. Frumpkin. Is their testimony incorrect, or not testimony? Is what they've said incorrect?
Let me try to respond to this for you, Mr. Miller. I believe their testimony is correct in terms of what actually happened to the document. I don't believe Dr. DeRosa saw the document until 3 weeks after the document was issued. It was never our expectation that the division supervisors be excluded from the review. I don't believe there's any written emails to that effect or any type of information that would suggest that that was done. It may very well be that the individuals in his team had that perception, but it was not a perception that was given to them by us.
Dr. Sinks, I'm also inclined to conclude when there's a silence in emails, when that seems to be the ordinary method of communication, that means that it didn't happen. Do you have an email, this is to both Dr. Frumpkin and Dr. Sinks, to support the testimony today that you encouraged Dr. DeRosa to prepare a response to the February 2007 health assessment to say that it was flawed? It had not gone through ordinary reviews, and there were scientific concerns about it, and it might be misleading.
I don't recall email communication on that point, Mr. Chairman, but I do recall very clearly that when Dr. DeRosa finally weighed in on the issue of the report several weeks after it was released, I recognized that his concerns were correct and indicated that we should act on them.
Okay. Now, when you said finally, do you have any basis to contradict what he said earlier, which was that he acted as soon as he had a chance to read it? He immediately emailed you to express his concerns.
Well, Dr. DeRosa's opportunity to be involved began in June of '06 when his staff began their involvement on the issue, or certainly in December of '06 when I asked him to involve himself and keep me informed. But for reasons that are unclear to me, he didn't take that opportunity to be involved until much later.
Well, the wording of his email, his second email to you, would be very peculiar if, in fact, there were oral discussions during that period. Since his first email, he says, I'm resending the previous email, which describes my concerns regarding the formaldehyde health consultation. If I receive no objections from you, I will send the attached letter to FEMA by COB. What does COB mean? Close of business, excuse me. Friday, March 9. Had there been conversations apart from email communications between the time of the first email and that second email? I mean, it certainly the tone of this email, the email implies that he hadn't heard from you.
I think that's correct. I had not seen his first email until he resent it.
Dr. Sinks, did you send the first email? I think it was copied to you as well.
Well, Dr. DeRosa sent the email. I can say that I did see the email. I did not respond to the email. And when Dr. DeRosa sent it about 1 week later, Dr. Frumpkin responded to it.
All right, I'm gloriously over. Mr. Lamson.
Apology, Mr. Chairman. I was waiting for you to give me time, and I didn't know you'd recognize me. Please accept my apology. Thank you very much. Admiral Johnson, did you say a while ago that I hear, maybe I heard something incorrect, but did you say that there had been some testing done in 2005?
Reported to us was that there was some testing. Bechtel Corporation, who was a subcontractor, a contractor for FEMA, had asked for some testing of for formaldehyde in units that their employees were working. I believe we were really unaware that that had taken place, but it did occur in 2005.
When FEMA proceeded, was it under some direction or whereby the emergency housing that it provided, did you have a mandate to go forward with the knowledge that you had, indicating that the housing that it was providing was safe and fit for short and long-term housing?
When we began, we've actually been using travel trailers and mobile homes for a number of years for disasters. It's a very common form of temporary housing, and when we used them in post-Katrina, it was full expectation it would be suitable housing for all the disaster victims who would use them.
What would be temporary?
Typically, temporary in most disasters is going to be less than perhaps less than 6 months. This is only the second time, I think, in our history that we've had a disaster that's gone beyond that and had people in travel trailers, which was not typically the expected duration of their stay.
Why did FEMA, when requesting the ATSDR, provide health guidance on safe levels of exposure to formaldehyde as late as 2007, ask that the evaluation be restricted to short-term exposures? And why would FEMA request that when residents had already been living in those trailers for 2 years?
The primary concern at that time, again, with knowledge now, we look back and wish we knew what we knew then. At the time that we were asking for that support, we were really trying to mitigate the effects of formaldehyde. At that time as well, sir, as I mentioned in my opening statement, there were we were leading up to 143,000 families in travel trailers. We were still standing up new group sites at that time, just a few months after the disaster. So we began to recognize that formaldehyde was causing issues with our occupants. So we were trying to figure out how can we do something about it? How can we mitigate the effects? And that was the primary effort of the first request for support.
As a part of that mitigation, have you begun to keep a list of all of the people who've lived in these trailers and set up a plan for monitoring the effects on anybody who may suffer illnesses because of it?
I'd say sort of yes and no to your question. Yes, we do have a record of all those who've lived in travel trailers and mobile homes. And at this point, we're working with CDC to begin to establish a registry that would track those families. The registry doesn't exist now, but we're working with CDC to establish that registry.
There was a FEMA and HUD press release on April 26th of 2007 that announced that individuals in travel trailers would be able to purchase their trailers at a fair and equitable price. What would you pay for one of those trailers?
Sir, I can tell you that we sold those on an average for about $300. Even today, with all of the media attention, the public attention, the government attention for formaldehyde, I was asked just yesterday, when will FEMA begin selling travel trailers again to the public?
How much did we pay for them?
I think in travel trailers, I would be guessing, I think it's about $8,000, $8,000 to $10,000.
Did the manufacturers give us a break on the price because we were purchasing a large number of them?
Well, I'm sure we got a good price. We bought a number of them. I'd have to get back to the staff on the exact cost of the units.
Would you please?
Yes, sir.
I don't believe we know the number, actual number purchased and the price per item, giving us a total. That could be a pretty big number, couldn't it?
Yes, sir. We still have, as of August last year, we stopped using travel trailers. We still have 3,500 travel trailers in our inventory that we are not using in current disasters today in Tennessee and Arkansas and other places around the nation.
Do you know when we purchased those, were they done? Was it a bid process?
Yes, sir. We bought, well, two things. First is that immediately after when the disaster occurred, again, overwhelming catastrophic disaster, we used all of the units around our inventory. We actually went and bought thousands of units that were on the lots of manufacturers and their distributors. And then we went back to the manufacturer themselves and had a separate order. So there were actually sort of three phases of providing the temporary housing.
You know how many actual trailer, or how many of those living in trailers have actually chosen to purchase them?
I think we sold, and then I think we sold about 900 units from FEMA, and then we worked through GSA, and they sold, I believe, some number of 5,000 additional units. We can provide that specific data. But we sold many thousands of units to the public. Some were occupants and some were just people who wanted to buy them for a recreational vehicle.
Okay, and were they given the same instructions regarding potential health effects? Were they warned before they decided to purchase the trailers about the formaldehyde levels?
When we began to, I think July of '06 was our first flyer that we sent out to all of the residents of mobile homes and travel trailers. Anything that we sold beyond that point, when we recognized the situation as it was, we did provide full information, access to our website, copies of the flyer, so that they were fully informed on their purchase.
I have one copy of a flyer here, and the language that's used in this flyer is fairly innocuous language. I would hope that there would be more detailed information given, certainly by the time that we began to have all of this information. And Mr. Chairman, I've gone way over my time. Are we going to have a second round? Are we going to have a second round? I'll yield my time right now and wait.
Yes.
I'll yield back my time right now.
Sorry, apparently I was not paying any closer attention to you than you were to me.
I'll do better next time.
All right, thank you. Dr. Frumkin and Dr. Sinks, according to documents provided by ATSDR, in addition simply to this February health consultation being copied to you, routed to you, that there was a briefing on it, an oral briefing that included the both of you. Now, when you testified, or not testified, when you were interviewed by our staff, you said you didn't remember much about that. Do you remember anything more about it now?
The document was described to us in our regular weekly staff meeting, and there was a discussion about it fairly briefly, as we have many items that we cover. I took a quick look at it at the time and asked for an executive summary and for some conclusions, since I noticed that they were missing and readers would have a hard time getting to the bottom line.
Do you recall who was there? I assume that Dr. DeRosa wasn't there, because the evidence is undisputed that he didn't know about it at that time.
Yes, sir, he wasn't there.
Okay. Was is it Keim, was he there?
I don't recall.
It would have either been Dr. Keim or his deputy who would have presented it to us in that issues management meeting. It's a weekly meeting. We go over many of the issues that we would be dealing with during that week, and it was presented probably in a couple of minutes, as this is a document that has been prepared by the division. And at that point, I know I did take a look at the document following the meeting. We were never provided a briefing. A briefing I would describe as the principal investigators and their supervisors meeting with us to describe what the work was that they were doing, why they were making certain decisions. We do have those briefings on a large number of subjects that our agency is involved in. There was never a briefing provided to us by the staff or the division.
Did you ever, I'm sorry, did you ask any questions? Do you recall asking any questions of that here at that meeting?
I can't recall the meeting specifically. I did ask to see the document. I did sit down and read the document once. I did provide some comments in the margins of the text, and provided that back to, it was probably Mr. Allred who provided that to us.
And you don't recall whether there was any discussion of whether what the procedures were for reviewing it, whether it had been reviewed by Dr. DeRosa, or who had been who had reviewed it at the Division of Toxicology and Environmental Medicine?
Sir, there was no discussion about it. We had made the assumption, and apparently incorrectly, that it had been reviewed by the division.
Okay, and was there any discussion of why it was being provided? Who had asked for it?
We knew that it was work that was going on. I can't tell you why it was presented to us at that time, if one of us had asked to see it or not. This was more than a year ago, but it was brought to us. I can tell you, sir, that in our policy, we do have a policy on review of health consultations, and it very clearly states that those health consultations are reviewed by various individuals in the divisions with the discretion to bring it to the office of the director. And whether that discretion is based on the division's recommendation or our recommendation, it can be either way.
Do you recall the March 9 email from Dr. DeRosa? Well, I'll read it to you, and it's according to what it says. It was from Dr. DeRosa to both of you, or to each of you. Ray draft letter to FEMA. The consultation was developed, sent forward, and signed by our DTEM staff. Now, the earlier email had already said that he had not seen it. They indicated to me that they had been directed to not share the information further and not to address longer-term health effects. That's why IARC was cited repeatedly without reference to cancer and was not included in the literature cited. FEMA's initial contact came directly to me 9 months ago on this issue. I reviewed the proposed statement and specified that they neglected to address longer-term risk, including cancer. FEMA then came back through our COPTER, COPTER, I assume that's an acronym, obviously it is, office with the same request, and this was assigned to DTEM staff. After completion of the consultation, our staff sent their signed consultation directly to COPTER, who sent out the letter. By separate email, I have shared this response with Mark Keim. If you wish for him to send it out, that's fine. Otherwise, I will send it at your direction. Either way is fine with me. So you obviously knew after this email that he had not reviewed the letter. Is that correct? Dr. Frumkin?
Yes, I think there are several points in that email on which we can agree. One is that we didn't adequately include consideration of long-term health impacts in the original consultation. And the second is that our document review process, which should have included Dr. DeRosa, didn't function as well as it should have. We've been very careful about relooking at our document review process, looking for where things may have operated not as well as they should have, and for opportunities to do better in the future.
Is there a procedure that shows is there a procedure for initialing, I think it's called buck sheets, anything like that at ATSDR to show who has seen a document?
There is for correspondence and for certain kinds of documents, but generally not for the documents within divisions.
So you, under your procedures, you would have no way of being able to look at the document, look at any document and know who's reviewed it. Is that correct?
The ways that we have of tracking documents across the agency are complex, and that's one of the things that we recognize the need to look at as we move toward improving in the future.
This email, again, they indicated to me that these were the DTM staff and members involved in developing consultation, that they had been directed not to share the information further and not to address longer-term health effects. That would appear to me to be a startling sentence in that email that should have gotten a great deal of attention for what had happened and why it had happened. But there doesn't seem to be any response that matches up to my response, which is to be startled that they had been told by FEMA what kind of report they wanted. Do you have any document that, I mean, do you have emails that say that's wanted to get to the bottom of this?
Let me respond to that in two ways. First of all, in Dr. DeRosa's email the week before discussing this, he says that he has spoken to his staff and he's taken care of the issue of making sure that adequate clearance goes through his division. I believe that's the email you mentioned the first time he sent a letter. I think our focus was actually on the content of his letter and what should be going forward, which was an appropriate thing to be doing. And we embraced his coming forward and recommending that level, and Dr. Frumpkin concurred, and we sent it forward.
Even after the letter went out, not the one that Dr. DeRosa had drafted, but someone else at your direction sent a letter to FEMA, a letter that apparently was placed in a file and not circulated at all at FEMA or given to anybody responsible for public health instead of liability. FEMA continued to tout ATSDR's assessment. It was in the press. It was in testimony before the Government Reform and Accountability Office, Accountability Committee here last summer. It did not always refer to ATSDR by name. It simply said scientific agency. When did you become aware that FEMA was continuing to tout ATSDR's flawed health assessment?
We were not adequately aware of the way the assessment was being used or interpreted or misinterpreted during that several-month period in early 2007. We focused on it much more intensively during the middle of 2007 when the media reports and the congressional oversight drew our attention to it. But we don't routinely track media reports about what other agencies are doing.
Sir, if I may add to
Sure,
that
Dr. Sinks.
Response, we also became much more heavily engaged in May, about the middle of May, when we were contacted by the Department of Homeland Security to become more engaged in the issue, and that's when we started to develop our plans for a more robust response to the formaldehyde issue.
All right, and Dr. Sinks, you did say a moment ago that you had in fact reviewed the letter, the health assessment.
Yes, I did see the health assessment. The first one, the first week of February, yes.
Did you read the first sentence? which reads, the ATSDR Emergency Response Program was requested by the Federal Emergency Management Agency, FEMA, Office of General Counsel to review and provide an evaluation of analytical data related to a project involving formaldehyde sampling at FEMA temporary housing units / trailers located in Baton Rouge, Louisiana.
Sir, I would have read that statement, and I believe there are actually earlier clues in the emails that would have indicated to me that the Office of General Counsel at FEMA had made that request of us. It was not something that caught my attention at the time.
Okay, well, the email that you sent, I think in October, in the fall of last year, that you were shocked to learn that it had been provided to a lawyer for presumably for liability concerns, not based upon concerns about public health. Did you just not pay attention? The lawyers usually get involved in the public health considerations?
Occasionally, lawyers do get involved in public health considerations. I think, Mr. Miller, I certainly had the opportunity to recognize that. All of us who did review the document or did read the document would have had that opportunity. There were also emails that had gone on before that would have given us that opportunity. It was simply something that did not catch my attention at the time.
The second paragraph of that email, unfortunately, the request was generated by FEMA lawyers attempting to respond to legal actions against FEMA. You said that this request must not have seemed extraordinary to our staff, but it didn't seem extraordinary to you either.
Mr. Miller, I think in retrospect we failed to recognize the import of a contact that came from an attorney rather than through typical technical channels. But please be assured that we are about protecting public health. We're not about litigation support. We undertook this work in a sincere effort to advance public health and in no way ever would compromise that mission.
Just one moment, please. Actually, Mr. Lamson is recognized for another round of questions.
Thank you, Mr. Chairman. Mr. Johnson, is FEMA taking mobile homes to Maxwell Air Force Base for testing?
I'm not aware currently that we're taking them to Maxwell Air Force Base.
We have learned that there's a plan to take some trailers there, I don't know the number, heat them up, measure the formaldehyde content, and then send them to Tennessee. You can't clarify that in any way?
What I would say is right now, as I mentioned before, if we provide a mobile home to any disaster site currently, which would be Tennessee, Arkansas, Oregon, those who have a current disaster, we have developed a protocol working with the Office of Health Affairs and DHS of how to test that unit so we can provide the test result to the state and to the potential occupant of that unit. Right now it's 7 days of not heating up, it's 7 days of a simulated actual situation, which in most cases involves using the air conditioner and climate control, humidity control. And so we have this standard protocol. We do test it. We use the same test company and the same protocol, the NIOSH protocol that was used by CDC, and we've actually done that successfully for the last probably 2 months. We've provided housing units that tested very low in formaldehyde to Oregon, and we're currently prepared to provide housing, mobile homes to Tennessee and Arkansas at levels where the state has accepted those units.
But you don't know for certain that testing is going on at Maxwell Air Force?
Well, we're doing testing in Selma and in Hope, Arkansas, so I'm not quite sure in Selma if that's at Maxwell Air Force Base, but that's where we have a facility that exists now for mobile home storage.
Although I'd like to believe that we won't have any more natural disasters that leave people homeless, we all know that it's probably going to happen at some time in the future. Is FEMA looking at alternatives for emergency housing? Can we use new green building materials to manufacture temporary housing that's healthier? What's your agency doing along these lines? And can you also tell me when FEMA anticipates that residents will be moved out of the trailers entirely?
Okay. Yes, sir. Good question. We have a joint housing solutions group that we stood up about a year ago, and their job is to reach out to industry and identify potential alternatives to mobile homes and travel trailers. And they've actually tested some are shipping containers, some are other modular homes, and they've actually looked at about 40 different alternatives that cost different amounts. Some take more setup than others, and we're exploring different alternatives to mobile homes and travel trailers. Last year, Congress appropriated $400 million for us to run an alternative housing pilot program in the Gulf Coast. And we currently have what are called Katrina cottages in Mississippi, and there's a current program in Louisiana, Texas, Mississippi, all to look at alternatives to mobile homes and travel trailers. And so we are very attuned to the need to find a broader range of solutions. Within the Gulf Coast right now, it's our desire to move all the residents out of travel trailers into more permanent alternatives, such as rental units, apartments, and the like. We want to have all out of group sites before hurricane season on the 1st of June. And we're working very hard every day to move about an average about 500 to 700 families a day leave a mobile home or a travel trailer inside the Gulf Coast today, moving towards more permanent locations. In some cases, that's their house. They have a travel trailer that's in their driveway as they begin to repair a house post-Katrina. And so it ranges from moving back into their house, moving with relatives, or moving actively into apartments and hotels and motels and other sorts of housing alternatives.
But 500 to 700 a day, and you're looking at hopefully completing it by June.
Well, we hope to get out of the group sites. In some locations, and I think it came up in a prior panel, in Louisiana, there appears to be an almost adequate number of alternative housing, apartments and rental units. In Mississippi, the local housing has not recovered nearly as quick. The issue with Mrs. Huckabee is that in that area of Mississippi, there are not available rental units. In some parts and other parishes and counties, very, very difficult to find alternatives. And so some people do feel, in order to stay close to family, to school, to work, to church, they're making a choice to stay where they are as opposed to moving to an alternative that we hope that we can provide to them.
Dr. Frumkin, your statement that we could and should have done better is an understatement. Your agency has failed to protect public health and failed to produce the best science. I still don't understand how your agency produced such a poor quality scientific report to FEMA, why you failed to improve or correct that report, and I also can't understand why you didn't personally communicate with your counterparts at CDC and FEMA when it was reported that trailer residents were experiencing clinical symptoms associated with formaldehyde exposure. In light of that incident, what changes have you instituted specifically at ATSDR to eliminate a recurrence of that situation?
With respect, sir, we've done an awful lot of very effective public health protection, but I have to agree that we didn't do the job we would have liked to have done with regard to the trailers. The opportunities for improvement that we've identified are in several domains. One has to do with the clearance and review of scientific documents. The Board of Scientific Counselors, which is an external group, is reviewing our entire scientific clearance procedure to see whether there are ways to improve that. In the meantime, we've reinforced to the divisions the need to abide by standard existing procedures, because that hadn't always been done, and it wasn't done in this case. With regard to management issues, also a potential opportunity for improvements, we've commissioned an outside review of our management procedures to see if we can identify opportunities for improvement there. And then, as detailed in our written testimony, there is a series of short-term solutions or improvements that we've implemented. For example, clarifying communication channels within and between agencies. The ways that we're triaging and tracking the issues that we manage have been considerably strengthened. We have our weekly meetings both for issues management and with senior staff, and we've clarified with all participants of the meetings the need to raise important issues and to raise them repeatedly if they remain active. We're tracking those actively now. So we have made some improvements internally. We have sought external oversight so that we can identify the very best opportunities for improvement as we move forward.
A little while ago, Dr. DeRosa testified that he has been put on a 90-day notice that he must show personal improvement and must embark on a personal improvement program in order to do so. Yet he is the one who helped identify the shortcomings that were there. Is that fair? Sure, Dr. Sinks.
And let me try to respond to that. First of all, Dr. DeRosa did identify one of two key issues with the report that were relevant with the February 2007 report. He identified the lack of long-term health issues being identified in it. Unfortunately, he did not identify the fact that it was using an emergency medical guidance as a level of concern, and I wish that he had actually identified that. I heard him testify earlier that in fact he had mentioned this to us, but I never recall having heard him bring this up before. And in fact, the first time we became aware of the problem was in the hearing that was mentioned in July. And I believe this was something I had the opportunity to have seen and I missed, and I believe everybody who reviewed that document had the opportunity to see that, and we missed that. Going back to the performance improvement plan, this is a standard document that is essentially an agreement that identifies the fundamental steps one should be taking in terms of their job to improve their performance. And that document was developed with several discussions with Dr. DeRosa about the types of activities that we thought his new position should be doing, what he wanted to do. He had significant input into that document. The elements in that document do relate to the type of work that he wished to do and I concurred with, and it's simply a document that identifies expectations for adequate performance. It's actually a document that is designed to help Dr. DeRosa to understand what the expectations are for his performance.
Are comparable steps being taken at John's level? Because were you not involved in the same level of failure?
There's accountability across all levels of our organization, sir, from the director's office, from myself and Dr. Sinks, to the division directors, to the branch chiefs, to the individual staff members. At every level of accountability, we take responsibility when we haven't performed well, and we work to make improvements. I need to emphasize that the reassignment of Dr. DeRosa was not in any way a retaliation for his actions in this case. His reassignment was a result of personnel actions that are best not discussed in a public forum like this. With regard to Dr. DeRosa's involvement in this particular situation, his major intervention during the one-year period between mid-06 and mid-07 was a suggestion that long-term health effects had been omitted from the report and needed to be included, and that suggestion was gratefully accepted and acted on. So it's important to decouple the personnel action that occurred in late 07 from a review of the events we're talking about today.
Is his job at stake?
There is absolutely no plan or no intention by me or anybody else I know to threaten his employment. His reassignment is at the same grade level, the same seniority level, and I view it as a long-term reassignment.
Do you feel that he interprets any of these actions as related to this issue?
That would be a question for him.
Certainly has feels that that was certainly the impression that came here. What steps exactly are y'all taking? And if you can't discuss them, can you submit it in public? Can you submit it to us to the committee? The steps for anybody, including yourselves, as far as accountability is concerned.
Yes, we can submit that in writing.
Okay. Thank you. Mr. Chairman, I yield back.
Thank you, Mr. Lamson. I think we are getting close to the end. There are obviously many points of dispute in the testimony and in the interviews, but I think everyone involved is going to have many opportunities to testify under oath about these events in deposition and probably at trial as well. I respect, Dr. Frumpkin, that you don't want to go into the personnel issues, but the memorandum of October 24 that you prepared, I want to read just an excerpt of that provided Dr. DeRosa with an unsatisfactory rating a year after being given a substantial bonus for as an incentive to stay in federal employment. During the past year, Dr. Rosa, was unaware of significant projects. His staff became involved in a project to assess formaldehyde levels in unoccupied FEMA trailers in June 2006. His office took it upon themselves to engage in this long-term, non-emergency evaluation. They were technically unprepared to do the work. In addition, they took direction from a FEMA lawyer without consulting their supervisors. ATSDR consultation resulting from their work was of inadequate quality and has since been revised. Is that still your view?
Yes.
Okay. And again, in the email that I earlier referred to and read from Dr. Sinks, and that email, you saw that email, did you not, in October to all the staff at ATSDR about the levels of formaldehyde and the inadequacies of the work done to that point?
I'm sorry, I'm not sure which email you're referring to.
It is dated October 12, 2007. It is from Dr. Sinks to all CDC, all outside. The attachment is final outside contact procedures.
Yes.
And did you direct that he send that email?
I concurred with sending it. We decided together that it needed to be sent.
Okay. And that says, unfortunately, the request was generated by FEMA lawyers attempting to respond to legal actions against FEMA. Our staff was asked to handle EPA-generated data as confidential. Those were extraordinary. That was extraordinary. Is that correct?
That's a very irregular process for an interagency collaboration. Yes.
Okay. But again, the assessment itself in the first sentence says it was at the direction or at the request of FEMA's general counsel. Isn't that right?
In the previous document that you read?
The assessment, the February 2007 assessment.
Yes.
Dr. Sinks. That's correct, right. And Dr. DeRosa's email of March 9, 2007, said also that the staff at ATSDR who prepared the report said that they were directed not to share the information further and not to address longer-term health effects. Is that also not something that would be very extraordinary?
Well, just I think half of that is certainly correct. If you look at the incoming letter of transmittal to the data from the lawyer to the ATSDR staff, right. It does direct them not to share the data. It does not limit the scope of the evaluation, at least in my read. Now, I don't believe Dr. DeRosa, Dr. Frumpkin, or I were ever in a discussion with FEMA about this consult, so we don't know exactly what the discussions were verbally. But in the letter of transmittal, it does ask the staff to hold the data confidential, but it does not, at least in my read of it, restrict the scope of the work.
But the email from Dr. DeRosa, which apparently is based upon oral discussions with those staff members, said that they were directed not to address longer-term health effects.
That would be a claim you'd have to discuss with Dr. DeRosa. Certainly that direction, to the best of my knowledge, didn't come from FEMA, and I know that it didn't come from within our agency.
I'm sorry. So when you got this letter and this email on March 9, 2007 about the health assessment that had just gone out the previous month, and it said that the employees involved were directed not to address longer-term health effects, you decided that what Dr. DeRosa said was wrong, that there was no such direction?
Rather than correct that statement, I focused on getting a correction out to FEMA so that we could set the record straight.
And and I understand that a letter did go out. It went out to the lawyer who'd asked for this in the first place, and because that litigation had been resolved, he put it in his file. He didn't give it to anybody. But what is very hard to fathom is that with the first sentence of the health assessment, which Dr. Sinks says he read, saying the request came from a lawyer, with the lawyer for FEMA, with the email saying that the staff involved had been told not to share the information, not to address longer-term health effects, but apparently dictating what was to be considered and what was not, you did not feel some sense of urgency other than to send a letter. And even when FEMA continued to tout the ATSDR's assessment as being scientific support, that everything was fine if you just opened the windows and doors, you didn't feel any sense of urgency to call somebody and say, didn't you get our letter?
The initial fix for the problem of too narrow a scope in the original health consultation was simply to broaden the scope. Rather than engage the assertion that there had been some limitation on the initial scope, we simply corrected it and set the record straight by sending the letter to FEMA. We did not follow up with FEMA to check on the implementation of the letter. And in retrospect, I think that we should have engaged during that first half of '07 more actively than we did.
Admiral, I don't want you to feel left out. FEMA Administrator David Paulson testified before the Homeland Security Committee, the House Homeland Security Committee, in May of last year and testified, we've been told that the formaldehyde does not present a health hazard. However, we do encourage our occupants of those trails to air them out, keep them open as much as possible to let the fumes die out. Was there a basis? Did anyone tell you besides ATSDR?
If I can answer that question by correcting one issue, there seems to be a focus on dealing with the lawyer and on FEMA's desire to avoid litigation. And I would like to at least make the record clear that while we had a lawyer, Rick Preston, who was primary in communication with CDC, there were other people from our Disaster Assistance Director who were also involved, and that FEMA's primary motivation was not to avoid litigation because we clearly went public with the information as soon as we received it. Our primary motivation was to get as much information as we could as non-medical people to make the best, do the best that we could to preserve the health and safety of the people who were living in these travel trailers. So I would like to make it clear that we were not trying to avoid litigation, and that wasn't our reason for going to CDC. When Administrator Paulson testified before Congress, I think it does reflect perhaps a misinterpretation of the report. It was our feeling at the time that based on the information we had both from EPA and CDC, that we didn't confront the health situation that we now know that we did.
Mr. Lamson.
Let me get one point of clarification, Mr. Johnson. When I asked regarding the provision of safe and fit housing for a short or long-term period, would you agree that your mandate is to provide safe and fit housing, whether it be long-term or short-term?
That's correct. I agree with that.
And was FEMA acting under that mandate when it provided those trailers, assuming that it was, well, when it provided the trailers?
That's correct.
For
Yes,
both
sir.
short and long term?
Yes, sir.
And is there a backup plan now adequate in your mind that if you come into another situation where you find that your step number one isn't working and you have to take emergency actions, that there is a way that we're not going to have people in harm's way again?
I think it would be nice to say clearly that the answer is yes, we've got this plan and it won't ever happen again. I think where we are is that while we are here, members of the manufacturing and housing community are also watching, and we're working with them. As I indicated before, we have been able to identify what parts of a mobile home or a trailer actually present the greatest risk from formaldehyde. We've worked with them recently to establish a unit that doesn't use urea insulation. It doesn't use vinyl gypsum board, and we've been able to reduce the level of formaldehyde to a much lower level now in one prototype unit than we've ever had before. We've just issued a contract to buy more of those units. And so it's our intent, we think, that we will need mobile homes in the future, and we want to be able to write a spec that requires significantly lower amounts of formaldehyde. We also have a range of options, from sheltering to apartments and motels and hotels and other things we try to do, and we use them even now. But situations in Greenburgh, Kansas, where the town is exactly blown away by a tornado, there are no close options that meet the needs of the individuals unless they travel great distances to work and with their home. And so we're working very hard to expand the range of options, look at things beyond mobile homes and travel trailers, but where we have mobile homes, to have them significantly reflect lower formaldehyde.
And then one last question. I brought up with, I can't think of her name right now, the lady from the trailer sitting out there, the dollars in healthcare costs that she has faced and many others have faced. And I did understand that FEMA has established a program to reimburse families for these medical bills. If that's the case, how many people have applied for such reimbursements, and if FEMA has paid money out at this point, how much?
So unfortunately, it's not the case. FEMA does not have authority in order to reimburse medical expenses. It's not the policy of FEMA or the government at this point to reimburse medical expenses.
I yield back my time, Mr. Chairman.
Let me just correct one number that I gave you. We are actually moving 1,000 households a week, not a day, out of travel trailers and mobile homes in the Gulf Coast, just to give you the right number.
Thank you. Thank you very much.
Dr. Fromkin, we've only talked about a couple of emails, and in fact, there have been a good many emails about this, but one that Dr. DeRosa sent from his BlackBerry on July 24 of last year, 2007, kind of late at night. Colleagues, while testing may be warranted, what immediate interventions are being pursued through appropriate channels to interdict exposures or to mitigate health impacts? I'm concerned that the reported clinical signs are the harbinger of an impending public health disaster. We know, based on data provided to us, that levels are up to 80 times higher than peak occupational limits and up to 300 times higher than our health guidance values. I think we must be more proactive in protecting the people while assisting FEMA. Do you remember getting that email?
Yes.
What did you do?
There was a lot underway already. First, I have to say that I agree with the sentiments in that email completely. We have to be proactive about protecting the people living in trailers. And it happens that at that point in time, we were undertaking a large range of actions that would lead to exactly that goal. Beginning in May, we undertook discussions with FEMA that launched all of the activities that are now underway that I described, the testing of occupied trailers, and that was a data set that we needed to determine exactly what the level of risk was. You couldn't extrapolate from the unoccupied trailers to the occupied trailers, so we needed solid data to help with that. The follow-up studies, the clinical reviews, and so on, all of those were underway or being planned at that point in time. So the sentiment behind Dr. DeRosa's email, the concern for the well-being of people in the region was very much a shared concern, and there were in fact a lot of activities underway at that point to help protect their health.
Did you do anything at that point to advise FEMA again, other than that letter sent to the lawyer? And when Admiral Johnson said FEMA didn't know about it, at least one employee of FEMA knew about it. That the February 2007 consultation health assessment was not one that they should be paying attention to. It should be relied upon. It was flawed. It was. I mean, you're very critical of it later. You're very critical of it in your evaluation of Dr. DeRosa as something that came out of his shop. But do you have anything in writing, or can you recall an oral discussion with anyone at FEMA that made those same criticisms and said, stop using that?
At about that time in July, we were revisiting the original consultation with a lot more attention than it had gotten before, and at that point we fully realized the limitations of that original consultation. And it was soon after that, I can't remember the exact date, when we made the decision to pull back the original consultation and reissue a more accurate document.
October.
October was when it was released, yes.
Okay, it was retracted in October. This was in July.
Yes, sir.
Okay.
Chairman?
Yes.
May I, are you about
Yes,
to
yes,
wrap
Mr.
up?
Lamson, Mr. Lamson.
Let me just, I don't, unless someone wants to make a comment about it, let me just make a comment here, I guess, at the end. But Admiral Johnson, because this hearing is focused probably more on the events of 2007, I'm going to overlook, I guess, your several, I think, misleading statements about FEMA's response to the formaldehyde issue in 2006. Suffice it to say that FEMA spent most of that year telling trailer to occupants that there was no problem and worrying about the impact of testing those trailers on FEMA's legal liability. In March of 06, FEMA's attorneys knew that EPA had determined that some people had negative reactions to formaldehyde at 0.1 parts per million and said any testing would have to be done quietly. But in May of 06, before it had done any investigation, FEMA issued a statement that there are, quote, no health concerns associated with formaldehyde inside, out, FEMA mobile homes and travel trailers, inside with those mobile homes and travel trailers. FEMA then delayed testing, even unoccupied trailers, because in the words of a FEMA attorney, testing would imply ownership of the issue. And your Office of General Counsel said that it didn't want the testing to determine what levels were unsafe, but only how to ventilate the trailers. Then, when ATSDR issued its seriously flawed health consultation, which FEMA officials described as giving them what we were looking for, FEMA's lawyers directed ATSDR not to release the study publicly so it could be reviewed. We all know that there is plenty of blame to go around, but we sure want to be talking about this in 07. It just, the lawyers were running the show.
Mr. Lamson, respectfully, I reject the notion that the lawyers are running the show. I reject the notion that FEMA made any decisions based on concern for litigation. What you see in emails is you see what occurs in many organizations of staff people talking with each other, raising pros and cons and concerns that should be considered by leadership, but don't make decisions by leadership. Every action that FEMA took, I think, was responsible given the level of knowledge we had at the time and what is clearly an insufficient sophistication about medical implications of formaldehyde. But the lawyers were advising, they were dealing in litigation, but we consistently made other options available to residents. We consistently put information on our website. Twice we hand-delivered 70,000 flyers to individual units. So I think if you judge us by our action as opposed to the interaction between our lawyers, I believe that given the knowledge we had at the time, I believe we took responsible steps.
At least with the emails that we have been able to see up here, it seems that all of the decisions were being made by the lawyers. And that's a problem from here as we see it. I voted against the creation of the Department of Homeland Security a number of years ago. I thought that it was going to create a horrible bureaucracy. I think it has, and I think that we're suffering a lot of effects because of our haste, because of our unwillingness to try to look and see what impact our decisions were going to have on the American people. Perhaps we made too many decisions, Chairman Miller, on the political strengths of our parties rather than the real needs of the people who are this country and our government. And I think that to some extent I'm ashamed of the way we have reacted, and the fact that people have had to come and tell us some of the stories that we have heard is embarrassing. To know that we have not followed typical protocol that you teach in basic science classes, about how you go about trying to make good, reasonable decisions with only taking into consideration real science. It's hard for me to go back to my 9th grade physical science class that I taught in many years ago and show them that this government was acting in the best interests of its citizens when we took some of the steps that we did. It's a little disheartening, ladies and gentlemen, to have to sit up here and say these things or to even think them, or to have heard from some of the brave people that did take the time to come up. And I hope that we never ever have to go through something like this again. And Mr. Chairman, I yield back my time. And again, I thank you for the effort that you have made and this committee has made on keeping this issue to the forefront.
I think this hearing is now concluded, although certainly not this matter. I think there will be a good deal more inquiry, both by perhaps other oversight committees, including perhaps this one, and certainly very possibly, very certainly in litigation as well, private litigation as well. Thank you for appearing. Under the rules of our committee, the record will be held open for 2 weeks for members to submit additional statements and any additional questions they might have for the witnesses. This hearing is now adjourned.